Yes, we are in the mid of the DAMS DVT, DAMS Visual Treat 2023. With all you audience out there, this has become my day. Yes. We are going to have the next session on a very interesting subject, pharmacology. And I have the pleasure of welcoming our beloved faculty, Dr. Thiru DVT, J, a wonderful person, a great entertainer. And students are really amazed by his ability to make even the most complex concepts understandable. Let's welcome him formally. A brief description of Dr. Thiru, as he is belovedly called by students. He's done his MBBS from Government Kilpak Medical College, Chennai. He's done his MD from Stanley Medical College, Chennai. He's been teaching in DAMS Medicos for 12 years and has a total teaching experience of 22 years. That's huge. Well, he finds that each day in the classroom is a gift, an opportunity to make a lasting impact. Well, that is true. As somebody has said, tell me and I forget, teach me and I remember, involve me and I learn. Well, that's very true. So get ready to get involved in the India's biggest medical PG prep academic event, the DAMS Visual Treat DVT 2023. We welcome Dr. Thiru DVT, who will be taking pharmacology. Over to you, sir.
Very good morning, doctors. I think we're enjoying DVT. So it starts. I'm going to start my session like a cinema movie. My movie starts DVT Pharma. To start, the first thing we're going to discuss, CVS blood renal. See, everything there in your workbook, just note down the answer. If possible, try to say loudly the answer, then you can enjoy the show. Okay, to start, anti-anginal drug that causes aphthous ulcer, like a one-liner, fill the blanks. The answer is Necorandil. Necorandil, a potassium channel opener, also having nitric oxide releasing property. For the first question, anti-anginal drug causing adverse effect of aphthous ulcer is Necorandil. It's a potassium opener having nitric oxide releasing property. Very good. All are doing very good job. Fantastic response. We start next one. Anti-anginal drug causing luminous effects, also called phosphine. Phosphine, it is ibabradine. Ibabradine. It is the funny current sodium channel blocker. Ibabradine is a funny current sodium channel blocker. It's a FDA approved drug for treatment of angina as well as for congestive heart failure. So ibabradine. Next. Answer. Name the anti-anginal drug aggravating movement disorder. For example, there's one drug going to aggravate Parkinson movement disorder. Name the drug. That is trimetazidine. Trimetazidine. Trimetazidine, one of the PFX, that is pathway of fatty acid oxidation inhibitor. Trimetazidine. Good response. All are doing very good, very fantastically responding good. Next. Nitrate should not be given along with. Answer please. Come on. Nitrate should not be given along with. Answer sildenafil. So very important. Repeatedly asked question. Look here. Nitrate acting by accumulating cycle GMP, and sildenafil, a PD5 blocker, that's also accumulating cycle GMP, causes severe hypotensive shock. Sometimes death can occur, so it should not be given along with the sildenafil. Very good. Next. Drug-eluting stents are prepared by using what? Drug-eluting stents prepared by using either sirolimus or by paclitaxel. Sirolimus. It's an, yeah, same response, man. Whatever we're discussing in the auditorium, the same response coming from DVT and also from the e-medical sub. I feel so proud of you people. Such enthusiastic people. Very good, very good. So question. Sirolimus, one of the immunosuppressant. Paclitaxel, one of the anti-cancer drug useful for preparing drug-eluting stent. And this is another very interesting question. Rho kinase inhibitor useful for treating angina. Answer? It is fasudil. Please note, fasudil, a Rho kinase enzyme blocker, also useful for treatment of pulmonary hypertension and for SAH. Yes, since you people are stimulating me, I am going to be a very good. Okay, so please enthusiastically, energetically enjoy the class. Within 2 hours, you are going to enjoy the pharmacology, and most important, all the good men, girl men, cats and KD triple, everything I extracted and going to give within 2 hours. So enjoy the show. Okay, so question, fasudil, a Rho kinase enzyme blocker useful for angina as well as for pulmonary hypertension and for SAH. Similar to this, we have something called Rho kinase enzyme blocker useful for treatment of glaucoma. What is that? That is called neetarsudil and ripasudil. This was the AIMS question. Neetarsudil and ripasudil are Rho kinase enzyme inhibitor. The question was, they are useful for glaucoma by what mechanism? The answer is increasing drainage of aqueous via canal of Schulman. Please note this. That's very important. The increasing drainage of aqueous via canal of Schulman. This was the old question. And then one latest point, expect a question. Rho kinase inhibitor useful for preventing graft versus host disease. What is that? It's a new drug called belumosudil. Belumosudil. It's a Rho kinase enzyme blocker useful for treatment of graft versus host disease. Drug name belumosudil. Some 1 or 2. I think, my dear friends, for 5 to 6 question, I put extra question after. For that, I will give some time. You please note down. Most of the questions are there in the book. 5 to 6 question I added. Okay, right. So, Rho kinase blocker useful for treatment of graft versus host disease. Belumosudil. Next, anti-angular drug useful for treatment of biliary colic pain. What answer? Last I mean belumosudil. Yeah, this one. Yes, yes. Please note I am showing the previous slide only. Belumosudil. Right. Now come to the point. Anti-angular drug useful in the treatment of biliary colic pain. Yes, good. All are doing very good job. Nitrate. But the question is the nitrate having smooth muscle relaxing property. Because I having smooth muscle relaxing, it is also useful for treatment of achalasia cardia. Okay. So question, anti-angular drug nitrate having smooth muscle relaxing property, based on that useful for treatment of biliary colic pain as well as useful for achalasia cardia pain. Okay. Right. Somebody asking the drugs for glaucoma, neetarsudil and ripasudil, both are increasing drainage aqueous via canal of Schulman. Okay. Mechanism action, it's increasing drainage aqueous via canal of Schulman. Next, drugs useful in the treatment of urinary colic pain. Answer please. Name the drug useful for treatment of urinary colic pain. For this case, either we can go for dicyclamine, or we can go for drotaverine. Dicyclamine, or we can go for drotaverine. Here the question is, Buscopan trained name doctor, good. buscopan trade name, but we go for tricyclamine. Okay. Now the question starts. Dicyclamine, a anticholinergic drug having smooth muscle relaxing property. It's an anticholinergic having smooth muscle relaxing property, thereby useful for treatment of hereditary pain. And then drotaverine. Here very important MCQs, mechanism action. Drotaverine, a PDE4 inhibitor, selective PDE4 inhibitor. It is also having smooth muscle relaxing property, thereby useful for treatment of hereditary. But what is most important? Remember, nitrates has no role. Please remember, nitrate has no role in the treatment of hereditary pain because nitrate do not have significant action on ureter muscle. Nitrate has no significant action on ureter smooth muscle, so nitrate do not useful for treatment of hereditary pain. This you must know. Okay, next. Come on, answer. Calcium channel blocker CCB useful in the management of SAH. What answer? Name the CCB. It is nimodipine. Very good, ma. Very good. Anushka, very fantastic. Dinesh Raj, very good. Nimodipine. Here also very important question. By what property this was useful for SAH? By what property? It has a property that is, it's a vasodilator. Vasodilator. Remember, whenever there is a hemorrhage, to prevent further hemorrhage, the surrounding vessel go for reflex vasospasm. If the spasm maintained for a longer period, it may cause ischemic brain damage. So, nimodipine useful to prevent the ischemic brain damage. So, the purpose of using nimodipine in SAH is to prevent reflex ischemic brain damage. Next. Answer please. Name the selective PDE3 inhibitor useful in the treatment of peripheral vascular disease. Answer. Name the selective PDE3 blocker useful in the. I'm asking is good. Is good. Kanakala. Very good, ma. It is silostazole. Silostazole. It's a PDE3 blocker useful. I'm asking selective PDE3 blocker. It is silostazole. It is acting by accumulating cyclic AMP. Acting by accumulating cyclic AMP. It has two property: vasodilatory property and antiplatelet property. Based on this, useful for PVD. Somebody are telling amrinin. Remember, amrinin, melrinin, PDE3 blocker. I do agree. They useful for congestive heart failure, not for PVD. For PVD, I'm asking selective PDE3 blocker mean go for silostazole. And somebody asking about pentoxifylline. Remember, pentoxifylline, one of the methylxanthin, it's a non-selective. It's a non-selective PDE blocker. It is not selective. It's a non-selective PDE blocker. And another important question, pentoxifylline useful for PVD by what property? That's the question. It is by rheological modification. What is rheology? Rheology means flexibility. Flexibility. Making the RBC more flexible. Thereby RBC can run even in microcirculation. Even in small vessel, it can go through. That's the answer. So, pentoxifylline, a non-selective PDE blocker useful for PVD. But my question, a selective PDE3 blocker useful for PVD. Silostazole, again, amrinin, melrinin or inodilator. Inotropic effect on heart and vasodilator action useful in the treatment of congestive heart failure. Okay. Can silostazole useful in non-STMI? Silostazole vasodilator mainly for perivascular disease, not for cardiac problem, doctor. Okay. Because silostazole may cause adverse effect of some arrhythmia. In fact, it is unsafe in heart failure, all these things. So it has some extra problem. Okay. Next. Which class of anti-arrhythmic drug can cause QT prolongation? Answer please. Name the class. Which class of anti-arrhythmic drug causing QT prolongation? Good. It's class 1A and class 3 drug. Very good. Because these two class drug having potassium channel blocking property. So class 1A and class 3 causes QT prolongation. Once again, if at all they cause QT prolongation, for treating, extra point, please note extra point, for treating the acquired long QT, for treating this long QT, what the best choice? The best choice is go for intravenous manganese sulfate, MgSO4. Intravenous MgSO4 is the choice. For treatment of acquired long QT syndrome, drug choice MgSO4. Once again, important question, can you please answer? What is the antidote? What is the antidote for the treatment of MgSO4 toxicity? The antidote is calcium gluconate. Remember, the antidote for MgSO4 is calcium gluconate. Everything old question, so keep on revise. Next, regarding arrhythmias, in case of atrial fibrillation, I have two type of treatment. First question, I want name some drug useful for controlling rate alone. They call rate controller. Name the rate controller useful in managing atrial fibrillation. When I say rate controller, that means there are some drug acting on AV node blocking the AV conduction. I mean, any drug blocking AV conduction can be useful for this. For this mnemonic, just mnemonic B, C, D. B for beta blocker. C for CCB, like verapamil diltiazem. B for beta blocker. C for calcium blocker, like verapamil diltiazem. And D for digoxin. It's a rate controller. Whereas you should know, there are some drugs useful for reverting the rhythm reversal. Now question goes to all people. Can I please answer? Name some drug useful for reverting the AF into normal sinus rhythm. They are called as amiodarone, ibutylite, dofetilide, and vernaculine. Amiodarone, dofetilide, vernaculine, ibutylite. Please answer. These four drugs are belonging to what group, man? The what group? They call potassium blocker, the so-called class 3 anti-arrhythmic agent, potassium blocker. So amiodarone, ibutylide, dofetilide, vernaculine, all are class 3 anti-arrhythmic agent, able to reverse the AF into normal sinus rhythm. Okay, next question. Come on, the time given is only 1 second. I want to check your medicine knowledge. Can you please answer? By looking the ECG rhythm, can you please make out what is the diagnosis of this? Here, QRS morphology main time, no P wave, rate is fast, and RR interval regular. Answer? Yes, fantastic. It is SVT. Now the two questions starts. In case SVT, for acute SVT, what is the drug choice? The drug choice for treatment of acute SVT, adenosine, intravenous adenosine is the choice. If the option not given, we can go for verapamil. So first choice is IV adenosine. Also we can go for verapamil. But theoretically speaking, the best first option go for adenosine. Again one question. The SVT may become recurrent. So please answer. To prevent the recurrence SVT, to prevent the recurrence, we should give some prophylactic drug. So question, name the prophylactic drug useful to prevent recurrence, mean go for this. So question, to prevent the recurrence, can we go for oral beta blocker? Oral beta blocker or oral CCB like verapamil or diltiazem. They are useful for preventing recurrence. Good, my good. All are doing very great job. Fantastic response. Good. Keep going. Right. Next, look at this. Look at this ECG. Here, look at the finding. There is a patient having, look at the heart. Contraction. 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 See, going far. Ventricular fibrillation. It's a medical emergency going to cause cardiac arrest. Now question starts. Normally, for managing ventricular fibrillation, what we are doing? Usually in practice for treating VT or VF, we go for first CPR, cardiopulmonary resuscitation. With DC shock, we go for DC shock. It is a treatment of choice. But my question for NEET paper, according to American College or Advanced Cardiac Life Support, ACLS, Advanced Cardiac Life Support, they say, what is the first line anti-arrhythmic? Anti-arrhythmic for treatment of VT or VF? It is intravenous amiodarone. Please note, according to ACLS guideline, the first line drug for treatment of VT or VF is intravenous amiodarone. If this option not given, next we can think of intravenous lignocaine. Lignocaine, a class 1B drug, that's also useful for VT and VF. So remember, the first line drug of choice for VT or VF mean think of intravenous amiodarone. Okay, next. Answer please. By looking the ECG, I want to know what is the diagnosis. Look at the tall and tending T wave. It's a diagnostic hallmark of what? It's a case of hyperkalemia. Okay. So now the question starts. Please answer. For managing hyperkalemia, it is one of the medical emergency, may cause cardiac arrest. To prevent this, what is the drug of choice? Here, first line drug of choice will be intravenous insulin plus glucose infusion. It is the first line drug of choice. But sometimes we can also give ECG changes. See, tall T wave. In this case, we can also supplement something called calcium gluconate. So first line drug of choice, insulin, glucose, intravenous infusion. Next, we can supplement calcium gluconate. And of course, as you are mentioning, we can also supplement salbutamol, a beta-2 agonist that is also useful for managing hyperkalemia. So, three main drugs useful for managing hyperkalemia includes, one is insulin with glucose infusion, calcium gluconate, and salbutamol. Okay, next. Easy state question. Name the anti-arrhythmic drug causes blue man syndrome. Look at the face. Blue color pigmentation on the face. Look at the limbs and so dark blue color pigmentation. Answer? It is amiodarone. Very good. Amiodarone. Blue man syndrome caused by amiodarone. Okay, good. Fantastic. Good. Next. Look at the ECG and tell me, what is this diagnosis? Look at the finding. There's a short PR interval and there's a slur in the ascending limb of QRS. We call this by name delta wave. Please answer. Short PR interval with the delta wave is pathognomonic finding of dash. Answer. Yes, fantastic. It is Wolff-Parkinson-White syndrome. Now question starts. For treating this case, look at it. Here, there's an abnormal conduction pathway. In addition to normal pathway, there's one accessory fiber connecting atrium with ventricle. Through this also impulses are traveling. It causes abnormal rhythm. So for treating this case, the drug therapy, when they ask about drug therapy mean, go for either flecainide or go for procainamide. Drug therapy mean flecainide, wonderful choice, most common drug from class 1C drug, or we can try procainamide, a class 1A drug that can be useful. So what Harrison textbook says, the best anti-arrhythmic agent for this case is either go for flecainide or from class 1A go for procainamide. Okay, but one question is, look here. In this case, what is the permanent solution? Come on, what is the permanent solution? The permanent solution is remove the fiber. That is called radio frequency ablation. Once again, in this case, there are some drugs to be avoided. What are the anti-arrhythmic drugs should be avoided? Any drug blocking AV conduction. If you block the AV conduction, all the impulses for SA node will divert through axillary fiber, causing more problem. So any drug blocking AV conduction, what mnemonic? BCD. So avoid BCD. That is beta blocker, CCB and digoxin. Avoid these three classes of drug because they are going to aggravate the conduction via axillary fiber. So better avoid this. That's about treatment for WAPW syndrome. Okay. And then answer please. Anti-arrhythmic drug to be avoided in this patient. Look at the patient. In this patient, the finding is there's a malar rash, that too butterfly shaped rash. That means it's a case of SLE. That means you should know which is the anti-arrhythmic agent causing SLE. Yes, very good. It is procainamide. Good. Procainamide. Remember, doctor, procainamide is a class 1A drug. It undergo metabolism by acetylation. Remember, any drug undergo metabolism by acetylation has the risk of causing SLE. For example, I think you know sulfonamide, hydrolyzin, isoniac acid and procainamide. Sulfonamide, hydrolyzin, isoniac acid and procainamide. They undergo metabolism. All these drugs may cause adverse effect of SLE. So procainamide causes SLE problem. So be careful in this patient. Next, look at this. Interesting question. Who is going to answer? Anti-arrhythmic drug to be avoided in this case. What is case? Here I given increasing pressure called glaucoma. Here there's a benign prostatic hypertrophy causing urine retention. So you should know which is the anti-arrhythmic drug to be avoided in this case. Come on, answer. See, any drug having anticholinergic property should be avoided in glaucoma, in BPH. Now think, come on, think. Yes, fantastic. Kriti, fantastic. Hey, timolol is not an anti-arrhythmic agent. Timolol is a beta blocker used for glaucoma. Asking, name the anti-arrhythmic agent. The answer should be anticholinergic property called diazopamide. Diazopamide, okay, or disopyramide. We have flecainide, enkinide, perfume, medicine class 1C drug, quinidine, procainamide. We have quinidine, procainamide, disopyramide, class 1A drug. It's a class 1A drug having highest anticholinergic property. Because of that, it causes glaucoma. It causes urine retention. So, diazopamide should be avoided in patient with glaucoma or with BPH because they are going to further aggravate this problem. Okay. Next. Ready? Anti-arrhythmic agent to be avoided in this condition. Now tell me, name the anti-arrhythmic agent avoided in this condition. Here I mentioned asthma. That means any drug having non-selective beta blocking property. For example, propranolol. Or any drug having a beta blocking property like propafenone. Remember, propafenone actually a class 1C drug. It is also having beta blocking property. So, propafenone and esmolol is a cardio-selective beta blocker that may be safe, whereas non-selective beta blocker, those blocking beta 1 and beta 2, they are the one unsafe in asthmatic patient. Esmolol is a cardio-selective beta blocker. So my question, anti-arrhythmic agent to be avoided in asthma, we have go for either propafenone or ism. Okay, yes, good. Somebody Ritvik, adenosine, very good, fantastic man, very fantastic. Adenosine also having bronchospasm, good. Adenosine also having bronchospasm property, so that's also relatively unsafe. Okay, Sotalol, a non-selective. Yes, good. That's why I put sotalol. Either you can say propanolol or sotalol. All are having non-selective beta blocking property. Okay, right. Ready? Another fantastic question. Please answer. Anti-arrhythmic agent to be avoided in this patient. Patient is having liver cirrhosis. Answer? The answer is amiodarone. Amiodarone. Good. Now the question starts. When you talk about amiodarone, look at the point. It causes first fatty infiltration. Next causing hepatitis. Finally landing in cirrhosis. Look at the stages. First fatty infiltration, then hepatitis, then cirrhosis. Can you please answer? The same pattern of liver damage we see with what? We see with the alcohol. So now look at this. This amiodarone induced liver damage looking like alcohol liver, but it's not due to alcohol. So I'm going to call this pseudo alcohol liver. So question, amiodarone induced liver damage we call by name pseudo alcoholic because it is looking like but not due to alcohol. Looking like alcohol called pseudo alcoholic liver damage. Okay. Next answer please. Name the anti-arrhythmic drug causing severe diarrhea. Anti-arrhythmic causing severe diarrhea. It is quinidine. Quinidine, a class 1A drug. It has the risk of causing severe diarrhea. Okay. Similarly, name the anti-arrhythmic drug causing severe constipation. Come on. Name the anti-arrhythmic drug causing severe constipation. That is CCB, like verapamil. One of the most important non-cardiac adverse verapamil constipation. Verapamil causes. This is recently asked NEET PG question. You must know. Verapamil causes constipation. Okay. Next. Answer please. Name the anti-arrhythmic drug causes adverse effect of hypothyroidism. It is amiodarone. Remember, amiodarone inhibit conversion of T4 to T3. Inhibiting conversion of T4 T3 thereby has risk of causing hypothyroidism. Similarly, look at the second question. Name the anti-arrhythmic drug causes adverse effect tremor. It is mainly by mexiletine. Remember, mexiletine, a class 1B drug, it causes severe nausea, gastritis and tremor. The important adverse effect of mexiletine causes nausea and tremor, also gastritis. So drug is mexiletine. Fantastic at answering. Deborgia. Good, always. Now look at this case. Name the cardiac drug contraindicated in this condition. First of all, can you make out what is the condition name? Look at the radiology. Look at the kidney artery. Look at this here and here. It's a case of bilateral renal artery stenosis. Now tell me, name some cardiac drug unsafe in this case. Good. It is AC inhibitor and ARB. Both are definitely contraindicated in patients with bilateral renal artery stenosis. Good, good, fantastic. Next, regarding heart failure, can you please answer? Name the BNP analog useful for treatment of congestive heart failure. Answer, it is neseritide. A BNP analog name neseritide. Here the old question was neseritide. It's a brain natriuretic peptide. Can you please answer? If a drug is peptide, it cannot be used orally. So my question, what is the route of administration of neseritide? This was the old question. It is given as IV infusion. So neseritide, being a peptide, cannot be taken orally, given as a slow IV infusion. Next, name the angiotensin receptor inhibitor available as a fixed dose combination with neprilysin. I want what is the composition of ARNI, angiotensin receptor and neprilysin inhibitor. Who is that? The answer is Yes, it is valsartan plus sacubitril. Very fantastic, good. Valsartan is the angiotensin receptor inhibitor. Sacubitril neprilysin inhibitor. The combo we call by name ARNI, angiotensin receptor and neprilysin blocker. Here, selective neprilysin inhibitor. Sacubitril name you must know, Sacubitril. Valsartan plus sacubitril is FDC for treatment of heart failure. Come on. Name the direct guanyl cyclase activator useful for heart failure. Direct guanyl cyclase activator. Drug name is vericiguat. New drug, a newer drug, please note, vericiguat. It's a latest drug useful for treatment of heart failure. It's a direct guanyl cyclase activator. Good, vericiguat. Next. Name some calcium sensitizer useful for treatment of heart failure. Calcium sensitizer. It is pimobendan and levosimendan. Pimobendan and levosimendan are calcium sensitizer. They also going to increase cardiac force of contraction. Drug name pimobendan and levosimendan. Okay, good, good. Next. Name the direct myosin activator useful in the treatment of heart failure. Myosin activator. It's a new drug name difficult. Omecamtiv mecarbil. Omecamtiv mecarbil. A direct myosin activator useful in the treatment of heart failure. Omecamtiv mecarbil. Very good, very good. Answering. Good, good, fantastic. Next. Name the drug inhibiting angiotensin converting enzyme plus neprilysin. This was 2 years back NEET PG question. Drug inhibiting angiotensin converting enzyme plus neprilysin enzyme. They are called omapatalot and sampatalot. Omapatalot and sampatalot. Both are inhibiting ACE plus neprilysin. The inhibiting ACE plus neprilysin, they call omapatalot, sampatalot. Good. Next. A newer drug, who is going to answer? Name the direct myosin inhibitor useful for treating this condition. Okay. The condition name HOCM. Please answer. Name the direct myosin. Yes, good. Tanu, good. It's mavacamten. Mavacamten is the direct myosin inhibitor. Okay. Now, please answer. Name the drug. Normally, when you see for HOCM, it's a newer drug. It's a newer drug. By my question, name some old drug or common drug useful for HOCM. The other drug useful for treatment of hypertrophy, obstructive cardiomyopathy, or commonly we go for propranolol. The most common drug useful for treating HOCM, propranolol. The other drug can be verapamil. So normally we go for propranolol. Other option verapamil, but latest drug is mavacamten. That's about newer drug for treatment of HOCM. Next, interesting question, same easy question. Name the drug useful in heart failure causing adverse effect of gynecomastia. Come on, sir. Name the drug useful for heart failure causing adverse effect of gynecomastia. It is, one is digoxin, one more drug, spironolactone. Digoxin, one more drug, spironolactone. Spironolactone, remember one more drug, digoxin also causing the problem. Okay, good. Next, intravenous antihypertensive drug useful for treating hypertensive emergency. Name some intravenous drug. Here a lot of drugs are there. Just go through. The intravenous drugs useful for treatment of hypertensive emergency are hydralazine, esmolol, a cardio-selective beta blocker, labetalol, a beta plus alpha blocker, a wonderful drug for treatment of hypertensive emergency in pregnancy. Then we have enalaprelot, then sodium nitroprusside, sodium nitroprusside, and then nicardipine and clevidipine, both are CCB, nicardipine, clevidipine, and phenaldopam, very important, phenaldopam, a D1 agonist, causing renal vasodilation. That's why one important point should remember, phenaldopam useful for treatment of hypertensive emergency with renal impairment. Since it is going to improve kidney performance, useful for treatment of hypertensive emergency with renal impairment. Another important question, labetalol is the most preferred drug, most important drug useful for treatment of hypertensive emergency in pregnancy. The most common drug useful for treatment of hypertensive emergency in pregnancy, think of labetalol. Okay. Next, we want to blood chapter. So far, cardiovascular is over. Now we go for hematology. Now, first question, name the antidote for thrombolytic agent. Remember, doctor, thrombolytic agent, we have something called altiplase, retiplase, tenetiplase. All are mechanism action. Old question. All are plasminogen activator. All are plasminogen activator. It is old question. But now our DVT question, name the antidote. Answer is epsilon amino capric acid. Very good, very good. Abhishek, very good. We have epsilon amino capric acid. That is the most specific antidote. Remember, the most specific antidote EACA, epsilon amino capric acid. The other drug can be useful to overcome the effect of thrombolytic drugs are either tranexamic acid or more drug aprotinin. The other drugs are tranexamic acid and aprotinin. But the most specific drug is go for epsilon amino capric acid. Okay. Next, very, very, very important, expected. This slide carries 4 MCQ. Everything very important. Look here. I'm going to talk about never oral anticoagulant. First question, please answer. Name the orally given direct 2A inhibiting anticoagulant. Direct 2A blocker name is dabigatran. This itself MCQ, dabigatran. Dabigatran is a direct oral 2A blocker. And another important question, what is the antidote for this? The antidote, this is most important, expected, please note. Edarucizumab. Edarucizumab, it's a antidote for dabigatran. Good ma, good. Edarucizumab. Similarly, another question, name the oral direct 10A blocker. Oral 10A blocker name is, we have apixaban, rivaroxaban, edoxaban, pectrixaban. All the drug name ending with a suffix called xaban. All are ending with suffix xaban. Apixaban, rivaroxaban, edoxaban, pectrixaban. And once again, antidote for these drugs, we have one thing called anti-zen alpha. The antidote for this case is intravenous anti-zenet alpha. It is an antidote. But once again, interesting question. For 2A blocker and for 10A blocker, for both the case, we have one common antidote. The common antidote for both is siraparentak. Please remember, siraparentak is a common antidote for both dabigatran and for direct 10A blocker. Siraparentak. That's also important. It's the latest point for Harrison book. Expected, please note. Siraparentak, it's the latest drug, common antidote for both 2A and 10A blocker. Next, interesting question regarding warfarin adverse effect. 2 image question. First question, warfarin may rarely causing adverse effect of hypercoagulation and dermal necrosis. Please answer. It is due to what mechanism? I want mechanism. By what mechanism it causing this problem? It is by inhibiting protein C. Warfarin causes hypercoagulation and dermal necrosis because of inhibiting protein C. By inhibiting protein C, it going to increases factor 5 and 8 level that causes hypercoagulation. So, warfarin causing hypercoagulation because of inhibiting protein C. Okay. Next question. Warfarin may cause purple toe syndrome by what mechanism? Purple toe syndrome due to what? Remember, warfarin causes this problem. It is because it releases cholesterol emboli from the atheromatous block. Please note this point. Purple toe syndrome is because of release of cholesterol emboli from the atheromatous block. So, warfarin causes purple toe syndrome. Sakshi, the previous slide is I just told about warfarin causes hypercoagulation and dermal necrosis because of inhibiting protein C. Protein C normally inhibit factor 5 and 8. If we inhibit protein C, it is going to increase factor 5 and 8 level. Okay. Yes. Protein C thereby inhibiting 5 and 8. Okay. 5 and 8 are written here. Right. Now look at this. Warfarin causes purple toe syndrome due to dash. Warfarin causing purple toe syndrome because of release of cholesterol emboli from atheromatous block. Okay. It's a releasing cholesterol emboli from atheromatous block. Okay. So, two things over, doctor. Hypercoagulation, dermal necrosis over. Second thing, and purple toe syndrome also over. Okay. Next question. Antidote for warfarin. Can I answer? It is straight question, simple question. What is the specific antidote for warfarin? It is vitamin K1, phytonadione. Phytonadione, it's a K1. But only one thing, it is the specific antidote everybody will know. But what is most important, it takes about 1 day, at least 1 day to bring down the INR. Since it takes at least 1 day to bring down INR, I cannot wait for 1 day. So my question, for immediate control of bleeding, I can go for what? For immediate purpose, I can go for fresh frozen plasma, FFP, fresh frozen plasma. But one question to all people, comparing to FFP, today we have one latest option. What is the latest option for immediate control of bleeding due to warfarin? The latest is, please remember, 4-factor prothrombin complex concentrate. 4-factor prothrombin complex concentrate. We simply write 4-factor prothrombin complex concentrate. It containing all the vitamin K dependent clotting factors, including protein C and S. So it is the most latest. It is a specific drug, specific option for treatment of for immediate control of bleeding due to warfarin. 4-factor prothrombin complex concentrate. Okay. Next. It is extra point. I think it is not there in the booklet. Please note. See, there may be one question. If a patient undergoing coronary artery bypass grafting during this CAPG surgery, during the surgery time, what is the best anticoagulant? The best anticoagulant during CAPG surgery, heparin. So this may not be there in booklet. Please add heparin. Previous slide, what? 4-factor. Dania, please make it fast. I am written 4-factor prothrombin complex concentrate. That is the latest option for treatment of or immediate control of bleeding due to warfarin. Okay. And remember, what is the best anticoagulant while doing CAPG surgery? Answer heparin and fractioned heparin. And antidote. Please remember the antidote for heparin, protamine sulfate. Protamine sulfate is the specific antidote. Okay. Next. Very simple question. Answer please. Name some safer anticoagulant for treating DVT in pregnancy. For treatment of thrombosis in pregnancy, name the safer drug. The safer anticoagulant in pregnancy are either we can go for heparin or we can go for low molecular heparin or we can go for fondapacetic. So safer drugs are either heparin or we can go for low molecular heparin or we can go for fondapacetic. Remember, warfarin contraindicated. Warfarin absolutely contraindicated in pregnancy. It causes teratogenicity. So safer drugs are heparin or LMWH or fondapacetic. Okay, next. I give 30-second time. Go through workbook and find out answer. Regarding mechanism action of antiplatelet drug, which is the wrong image? Come on, I think you have the workbook, no? Come on, find it. What is the wrong picture here? Look at the mechanism action. Look here. Aspirin inhibiting COX enzyme here. So both are right, okay? Look at this one. Ticlopidin, clopidogrel, prasugrel inhibiting ADP, okay? Look at this image. Ticlopidin, clopidogrel inhibiting PF. No. So, yes, good, all are good. Good. Answer B. Now look here, doctor. Name the drug inhibiting PF. PAF means protease activated factor. So, you must know, we have two latest antiplatelet inhibiting PAF. They are called oropaxar and etopaxar. Oropaxar, etopaxars are orally given latest antiplatelet. So oropaxar, etopaxars are latest orally given antiplatelet. They call PAF, protease activated inhibitor. But look at this. What are these drugs? This is important. There are 5 questions regarding P2 Y12 blocker. Please note down. It is extra point, doctor. Extra point. My class always has some extra point. Please note. The P2 Y12 inhibitor. We having ticlopidin, clopidogrel, prasugrel, ticagrelor and gyanecology all are P2 Y12 inhibitor. Here the first MCQ. Look at the first 3 drugs. The first 3 drugs are pro-drug. Okay. In this one important question, the clopidogrel, one of the most famous drug, it is activated by CYP2C9. What? Somebody asking previous. Previous is oropaxar and etopaxar. Oropaxar. Then the one oropaxar, etopaxars are protease activated inhibitor oral drug. Okay. Now concentrate on P2 Y12 blocker. We having ticlopidin, clopidogrel, prasugrel. All are first 3 drugs are pro drug. In this common drug, clopidogrel, remember, it is activated by CYP2C19. That's why, good. That's why, yes, good, Priya, very good. That's why it should not be given with omeprazole. Omeprazole, a proton pump inhibitor having the property of inhibiting CYP2C19. So, omeprazole and clopidogrel should not taken together. Old question. Another old question. Look here. Among the list of drugs, cangrel are intravenous. All other oral drug, gangrel are intravenous. Next question. Ticagrelor is the reversible P2Y2 blocker. All others are irreversible. Remember, all others are irreversible like P2Y12. Ticagrelor is a reversible P2Y2 blocker. And next question, the prasugrel and ticagrelor are more effective drug. Today they say the most efficacious P2Y2 blockers are prasugrel and ticagrelor. They are most effective drug. Okay. Next question regarding kidney chapter. Come on, rapid fire round. Simple, clinical based question. Look here. Regarding diuretic, answer please. Name the diuretic indicated for treatment of ascites in patient with cirrhosis liver. Answer please. Name diuretic. It is final item. Very good. But which is diuretic contraindicated in this patient? Acetazolamide. No doubt. Acetazolamide may cause accumulation of ammonia. It causes hepatic encephalopathy. So, spironolactone is the best option, but don't use acetazolamide. Good. Next, regarding diuretic, come on, just fill in the blanks. Regarding diuretic, please answer. Name the diuretic useful for rapid relief of symptoms of acute heart failure. In acute heart failure, there is a pulmonary edema, breathlessness. Name the diuretic useful for rapid relief breathlessness. It is furosemide. A loop diuretic. Whereas furosemide useful only for symptom relief. It is not going to modify disease. So question, name the diuretic useful to modify disease. I want disease modifying diuretic. Answer is spironolactone. Spironolactone, a disease modifying diuretic. Whereas one question, name the diuretic contraindicated in patient with pulmonary edema. It is mannitol. Mannitol contraindicated in patient with pulmonary edema. Mannitol contraindicated. Next, regarding diuretic. Come on. Which is the group of diuretic causing calcium stone formation? Name the group of diuretic causing calcium stone formation. It is loop diuretic. Loop causes calciuria. They cause calciuria. By causing calciuria, they causes calcium stone formation. Whereas name diuretic useful for treating stones. The treatment of stone is thiazide. Thiazide causes calcium reabsorption. So preventing stone formation. So thiazide useful for treatment of stones. Remember, thiazide and loop having opposite effect on calcium metabolism. Okay. Next, regarding adverse effect, please answer. Name the group of diuretic causing adverse effect of ototoxicity. It is loop diuretic. Especially one drug called ethacrenic acid causes maximum ototoxicity. All loop diuretic may cause ototoxicity. Among this, ethacrenic acid causes maximum ototoxicity. Okay. Next, easy question, important question. Name the diuretic causes or group causes adverse effect of erectile dysfunction. Name the group of diuretic causing ED. Answer, thiazides. Thiazide causes adverse effect of erectile dysfunction. Okay, good. Name the diuretic causing adverse effect of gynecology. It is spironolactone. A diuretic causing gynecology, spironolactone. It has anti-androgenic property. Thereby risk of causing gynecology. Very good, man. Very good. And I think this may not be there. Please add some extra point. Come on. Name the group of diuretic causing adverse effect of hyperuricemia. Causing adverse effect of gout. Can you please answer? It is loop and thiazide. Loop and thiazide causes adverse effect of, yes, good. Loop diuretic and thiazide diuretic causes adverse effect of hyperuricemia. Loop and thiazide. Good, good, good. Loop and thiazide. Good. Next, very simple, straight question. Please answer. Name the diuretic useful for treatment of mountain sickness. Name the diuretic useful for treating mountain sickness. It is acetazolamide. Acetazolamide useful for treating mountain sickness. Very good. And name the diuretic useful for treatment of idiopathic hypercalciuria. Hypercalciuria is also called Williams syndrome. When there is a hypercalciuria, to treat this, I have to inhibit calcium excretion. That done by thiazide. Thiazides are useful for this case. Thiazide. Answer thiazide. Thiazides. Next. Very easy question. Name the diuretic useful for treating hirsutism and for PCOD. Very simple. Spironolactone. It has anti-androgenic property, thereby useful for treatment of hirsutism and for PCOD. Drug name spironolactone. Very good, ma. Very good. Spironolactone having anti-androgenic property, useful for treatment of hirsutism and for PCOD. Next, I think a little bit tough question. Try. Name the diuretic useful as an aerosol. For treatment of cystic fibrosis, going to improve mucociliary secretion. Yes, good, very good, very good. It is amiloride. Good, ma. Amiloride going to increases mucociliary secretion. Good. All are doing very great job. Fantastic. Last slide we had in spironolactone. Spironolactone having anti-androgenic property, useful for hirsutism and PCOD doctor. And now you are trying good answer. Amiloride useful for treatment of cystic fibrosis. It has the property of increasing mucociliary secretion. Okay. Next, very simple question. Please note. Name the diuretic useful for treatment of Liddle syndrome. It's a congenital overaction of ENaC. Come on. It's a congenital overaction of ENaC. Epithelial sodium channel overaction. So for treating this case, I need one ENaC blocker. Epithelial sodium channel blocker. Who is that? That is amiloride. Amiloride is the ENaC blocker that's useful for this case. Amiloride. Yes, good. And it's a new point doctor. It may not be there in the workbook. Please add latest point. Please add. We have one diuretic named by phenarinan. Please note. Phenarinan. It's MRA. MRA means mineralocorticoid. Receptor antagonist. It is useful for treatment of diabetic kidney disease. Okay. So question, phenarinan, a mineralocorticoid receptor antagonist, useful for treatment of diabetic kidney disease. New point. Just remember phenarinan. Mineralocorticoid receptor antagonist, useful for diabetic kidney disease. Next, 5 question. Please answer. Name the common drug of choice for treatment of nocturnal anaesthesia. Come on. Name the drug of choice for treatment of this case. The drug of choice means desmopressin. Remember? Drug of choice for treatment of nocturnal anaesthesia, desmopressin. Whereas we can also give imipramine. Imipramine, one of the tricyclic antidepressant, having very high anticholinergic property. Because of this action, it causes urine retention. By causing urine retention, useful for this case. So question, imipramine can be also supplemented. Okay. Please answer. Name the fantastic drug of choice for treatment of cranial diabetes insipidus. For this case, again, drug of choice desmopressin. It's a V2 analog of vasopressin. V2 analog of vasopressin, and that is a drug of choice for managing cranial diabetes insipidus. And for treatment of nephrogenic diabetes insipidus, we can try thiazides. Thiazide can be useful for nephrogenic. And very easy question, for treatment of lithium-induced diabetes insipidus, drug of choice amyloid. Drug of choice is amyloid. And finally, SADH. Please answer. Syndrome of inappropriate ADH secretion. For treating this case, I need ADH antagonist called V2 antagonist. They called as vaptane. For example, we are having lexivaptane, mosavaptane. Remember, we are having lexivaptane, mosavaptane, and tolvaptane. So please note down some vaptane name. Lexivaptane, mosavaptane, setavaptane, tolvaptane. All the drug name ending with the suffix called vaptane. They are the drug of choice for treatment of SADH. Dimuclocycline, a tetracycline that can be useful for diabetes. They causes diabetes insipidus, thereby can be useful for this case we can try dimuclocycline. But my question, choice is vaptane. Okay. Somebody asking, John B. Among the actually gangrel or intravenous. Among the intravenous drug, that is reversible. Among the oral drug, reversible ticagrelor. John B. Among the IV drug, we have something called gangrelor. Among the oral drug, ticagrelor. Both are reversible. P2 Whitelbacher. Okay. Yes. Next. What about pulmonary hypertension? Come on. Just interesting. It's very, very important chapter. Answer, fill the blanks. Name the nitric oxide independent diarrhea guanyl cyclase activator. It is rheozygote chinozygote. Yes, good, fantastic. Next. Name some endothelin receptor blocker. Useful for this case. Endothelin receptor blocker. We are having bosentan, ambrisenden, macicenden. Bosentan, ambrisenden, and macicenden. All are endothelin receptor antagonists. Next. Name the Rho kinase inhibitor useful for this case. That is phosphoryl. Rho kinase enzyme blocker, phosphoryl. Another one more film block. Look here. The prostacyclin receptor stimulant. PGI2 receptor stimulant is a drug called Celexipac. Celexipac is the prostacyclin receptor stimulant. Drug name Celexipac. Good. All are answering very nicely. Remember, iloprost. It's a prosto. Somebody telling iloprost. Iloprost. It's a PGI2 analog. It's useful. I do agree. But my question, receptor stimulant. That is Celexipac. Iloprost, it's a prostacyclin analog. Hypoprostinol, treprostinil, beroprost, iloprost, all are prostacyclin analog. My question, prostacyclin receptor stimulant is Selexipag. Okay. Next, one latest point. I think it's a new extra point. Please note. We got one thing called endothelin plus angiotensin 2 blocker named by Sparsendan. Please note that one. Endothelin plus angiotensin 2 blocker Sparsendan. It is useful for treatment of immunoglobulin A nephropathy. Sparsendan useful for managing immunoglobulin A nephropathy. Sparsendan useful in immunoglobulin A nephropathy. Okay. Next, we want to CNS. If we thoroughly enjoy CNS, very important topic. Lot of question coming from this area. So thoroughly enjoy you can be master in pharmacology. So please go through. First chapter, sedative hypnotic topic. Okay. Next, CNS depression causing skin vesicant problem. Answer please. Name the CNS depression causing skin vesicant. That is barbiturate. Barbiturates. Okay. Now one question. Look here. Barbiturates causes bullous eruption. Bullous eruption. Now one question. In case of poisoning, we don't have antidote. Can you please answer how to treat this case? For treating this poisoning, what can be done? I want treatment for poisoning. See, there is no antidote. Barbiturates are acidic. There are acidic drugs. Can you answer how to remove the acidic drug from the body? By making urine alkalization. So treatment is by forced alkaline diuresis or by hemodialysis. Treatment is forced alkaline diuresis or by planning for hemodialysis. This is old NEET PG question. Remember, for treating barbiturate poisoning and for treating aspirin poisoning, we go for forced alkaline diuresis. Old question. Next, answer please and fill the blank. Orexin antagonist useful for treatment of insomnia. Name some orexin antagonists useful for treating insomnia. They are called suvorexin, lemborexin, and daridorexin. Suvorexin, lemborexin, and daridorexin. Look here. Look at the spelling. O-R-E-X, orex. And A-N-T, antagonist. Orexin antagonist. Drug name suvorexin, lemborexin, daridorexin. All are orexin receptor antagonists useful for treatment of insomnia. Okay. Next, name some melatonin analog useful for treatment of insomnia. Melatonin analog. For example, we have remeltion, tesimeltion, and agomelatine. Remeltion, tesimeltion, agomelatine. Remeltion, old question. Remeltion useful for treatment of insomnia, especially useful for treatment of sleep onset insomnia. Useful for treatment of sleep onset insomnia. Important. Okay. So remeltion. Okay. Next. Most of the benzodiazepine undergoes metabolism in liver. So benzodiazepine in general unsafe liver disease. But my question, name some benzodiazepine safe in liver disease. For example, a patient having liver disease, having insomnia. For treating insomnia in liver disease, I want some drug. What are they? For example, the safer benzodiazepine in liver disease include we having temazepam, oxazepam, and lorazepam. Remember, safer benzodiazepine in patient with the liver disease includes temazepam, oxazepam, and lorazepam. Once again, what is oxazepam? Old question. Oxazepam is an active metabolite of diazepam. Oxazepam is an active metabolite of diazepam. So the safer drugs are Temazepam, oxazepam, lorazepam. In this one more point, oxazepam is an active metabolite of diazepam. Okay. Next question. Name some drug useful for treatment of narcolepsy. Narcolepsy means excessive daytime sleepiness. For treating this, what can be useful? For example, we have one thing called solriamfetol. Solriamfetol, it is one of the NDRI, norepinephrine dopamine reuptake inhibitor. New drug. Then pitolisant, it's a H3 inverse agonist. Pitolisant, H3 inverse agonist. One more thing, as you were telling, modafinil, a sympathetic stimulant, a CNS stimulant, modafinil. You are telling, very good. So question, the drug useful for treatment of narcolepsy or solriamfetol, pitolisant, and one more drug, modafinil. I just remember, name the NDRI, name the H3 inverse agonist useful for narcolepsy. Remember the two new points, solriamfetol, one more drug, pitolisant. Okay. Now, the most wonderful, important topic in CNS anti-epileptic chapter. Lot of questions are there. I'm going to take everything. So, just make a fast revision. Look here. Regarding anti-epileptic, this year one question came based on the picture GABA analog question. I have 4 questions in this slide. One question. Come on. Just everything there in your workbook, just fill the answer. First question. Name the GABA reuptake inhibitor. Please answer. Name the GABA reuptake inhibitor. Hey, Ayush, NDRI full form. What man? You are going for NEET exam. NDRI full form. RI, reuptake inhibitor. ND, norepinephrine dopamine. Norepinephrine dopamine reuptake blocker. Okay. Now come to the point. Name the GABA reuptake blocker. Answer tiagabine. Good. Tiagabine. GABA reuptake blocker tiagabine. First fill in blank over. My second filling blanks, please note. Second question. Name the GABA transaminase inhibitor. Come on. Name the GABA transaminase inhibitor. It is vigabatrin and valproate. Vigabatrin and valproate. GABA transaminase inhibitor. Includes one is vigabatrin, one more drug, valproate. Third film blanks. Name the glutamic acid decarboxylase activator. Name the glutamic acid decarboxylase activator. It's a valproate. Name the glutamic acid decarboxylase activator. Main answer valproate. Okay. And finally, one important question. Name the drug called ligand for sp2a. S mean synapse. V mean vesicle. There's one drug going to act on vesicle and going to promote the release of GABA into synapse. Who is that? That is good. Levetiracetam. Very fantastic. Answer levetiracetam. It's a ligand for SV2A. This is the very important slide based on the mechanism action based question. Levetiracetam, ligand for SV2A protein. Next. Come on, clinical question. Name the drug of choice for absence seizure. Absence seizure, also called petit mal seizure. Look here. Just primary absence seizure. Only absence, star look. Nothing else mean. The choice can be ethosuximide, a T type of calcium channel blocker. So choice. Whereas a child having absence seizure with myoclonic jerk or tonic seizure mean, in their case we can go for valproate. Remember, only absence seizure mean I can go for ethosuximide. Absence seizure with the extra problem mean I go for valproate. Remember one point. Apart from this drug, what are the other drugs useful for this case? The other drugs useful for this case are either lamotrigine. Just note, this was old question. What are all the drugs useful for absence seizure? They may give option A alone, A and B, A, B, C, like this. So, what are all the drugs useful for absence? You mean go for first choice ethosuximide. Other can be valproate. Other options are lamotrigine, clonazepam, clobazam, cannabidiol, and acetazolamide. The other drugs are we having either lamotrigine, clonazepam, clobazam, cannabidiol, and acetazolamide. They can also try for absence seizure. Okay. Next. Ready? Says. Shall we move next one? I'm waiting. Yes. Okay. Next one. We move on to Lennox-Gastaut syndrome. Lennox-Gastaut syndrome. See, it's a seizure in childhood, multiple pattern seizure with mental retardation. For this case, always the drug of choice valproate. For Lennox-Gastaut syndrome, the drug of choice always valproate. But remember, what are the other drugs can be useful for this case? The other drug useful for this case also important. We can also try lamotrigine, felbamate, topiramate, and clobazam. Original drug of choice is valproate. Cannabidiol is a new drug, man. Other options are either we can try lamotrigine, felbamate, topiramate, and also yes, good. You can also go for rufinamide. Good. Rufinamide. Yes, can add. Yes, good, doctor. Good. Rufinamide. Shagil. Fantastic, Shagil. Very fantastic. Good. So, question. Rufinamide also approved for treatment of Lennox-Gastaut syndrome. Okay. So, valproate is a choice. Other drugs are lamotrigine, felbamate, topiramate, clobazam. Okay. Mechanism, valproate having multi-mechanism action. Valproate sodium blocker, calcium blocker, GABA agonist, glutamate antagonist. It has all the property, man. Valproate is the broad spectrum anti-epileptic. It has multiple mechanism action, having sodium blocking property, T type of calcium blocking property, GABA agonistic property, glutamate antagonistic property, all property. Okay. Next, look at this infantile spasm, also known as West syndrome. Can I answer? What is the drug? For this case, 3 MCQ. First question, look here. Infantile spasm with tuberosclerosis, drug of choice, vigabatrin. Remember, infantile spasm with tuberosclerosis, go for vigabatrin. Simply infantile spasm, go for ACTH. So 2 points. So infantile spasm alone mean ACTH. Infantile spasm with the TS mean we go for vigabatrin. Once again question. In infantile spasm, can I answer? If we take EEG, what is the finding? We call by one name. What the rhythm we call by one name? What is the name? The name is Hips arrhythmia. Hips arrhythmia is the name given to EEG finding in patient with infantile spasm. Hips arrhythmia. Okay. Good. Next. Come on. Rapid fire round. Easy state question. Name the anti-epileptic causing adverse effect of pseudo-lymphoma. Answer, please make it fast. Pseudo-lymphoma caused by phenytoin. Phenytoin causes hypersensitivity reaction in the form of lymph node enlargement. We call pseudo-lymphoma. Good. Next. Name the anti-epileptic causing adverse effect of Stevens-Johnson syndrome in patient with HLA-B1502 gene. Name the antibody. Answer, it is carbamazepine. Carbamazepine. That's why whenever you use carbamazepine, please do genetic screening. Prior to using this drug, better to genetic screening to rule out this gene. Next. Answer question. Anti-epileptic causing adverse effect of toxic epidermal necrolysis and Stevens-Johnson syndrome. In general, name the anti-epileptic causes. In general, adverse effect of TN and AJS. Answer, it is lamotrigine. Very good. It is lamotrigine. Very good. Very good. Anti-epileptic causing adverse effect of hepatotoxicity. Remember, there are so many anti-epileptic causing liver damage. This is old question, multiple option based question. So please note what are all the anti-epileptic can cause hepatotoxicity. For example, valproate, and valproate by causing hepatotoxicity is also going to increases ammonia level, causes hyperammonia. It is latest NEET PG question. It causes hyperammonia. The other drug causing hepatotoxicity are carbamazepine, lamotrigine, phenobarbital, and felbamate. The other drug causing liver damage includes carbamazepine, lamotrigine, phenobarbital, and felbamate. Okay. Yes, good. Sahil, you are writing very nicely. Fantastic. Good. And this was the latest question. Valproate causes hyperammonia. Very easy question. Please answer. Name the anti-epileptic causing blue color pigmentation on skin and lip. Answer. Name the anti-epileptic causing blue color pigmentation on skin and lip. It is isogabin. Also known as retigabin. Remember, it's actually a GABA drug having potassium. It has potassium opener. Isogabin, also known as retigabin, it's a potassium opening drug, causes adverse effect of blue color pigmentation on skin and lip. Okay. Next, anti-epileptic causing adverse effect of purple glove syndrome. Sorry for the mistake in workbook. I mentioned purple toe. It's not purple glove. Just a correction in workbook. Purple glove syndrome caused by phenytoin. Purple glove syndrome by phenytoin sodium. Okay, good. Next, anti-epileptic causing adverse effect of weight loss. Answer, topiramate and zonisamide. Topiramate, zonisamide causes weight loss. Because of causing weight loss, both the drug got approval for treatment of obesity. So question, anti-epileptic drug approved for treating obesity means think of topiramate and zonisamide. Next, name the anti-epileptics causing adverse effect of kidney stones, nephrolithiasis. Answer, again answer, topiramate, zonisamide. Topiramate and zonisamide may also cause adverse effect of kidney stones. So weight loss and kidney stones are the main adverse effect of topiramate and zonisamide. Okay. Next, anti-epileptic causing adverse effect of SIADH. Answer please. It is a recently asked 2-time asked question. Come on. Name the anti-epileptic causing adverse effect of SIADH. It is oxcarbazepine. Yes, good. All are writing carbamazepine. Good. Carbamazepine, you are right. But comparing to carbamazepine, it causes maximum SIADH. Carbamazepine causes, I do agree. But comparing to carbamazepine, oxcarbazepine causes maximum risk of SIADH. Next, anti-epileptic causing adverse effect of visual field defect. It is vigabatrin. Anti-epileptic causing field of vision defect is vigabatrin. Just fill the blanks. Okay, vigabatrin. Yes. Next, anti-epileptic causing adverse effect. Rarely causing adverse effect of angle closure glaucoma? Answer, it is topiramate. Topiramate rarely causes angle closure glaucoma. Answer is topiramate. Very good. Good. Next. Come on, sir. Name the antibiotic called drug of choice for treating this case. The drug of choice mean answer carbamazepine. Drug of choice mean carbamazepine, but other drug. The other drug useful for this case are either phenytoin or lamotrigine. Remember, drug of choice mean carbamazepine. The other drugs are either we can say phenytoin or lamotrigine. But choice is carbamazepine. Very good, man. All are doing very great job. Fantastic. Keep going. Name some anti-epileptic very useful for treatment of diabetic peripheral neuropathy. It is gabapentin and pregabalin. Okay. The most common drug useful for treatment of diabetic neuropathy pain are gabapentin and pregabalin. And these drugs are gabapentin, pregabalin. That means GABA. They are GABA analog, but they also have N type of calcium channel blocking property. The main mechanism N type of calcium channel blocking property. So gabapentin and pregabalin are GABA analog, but has N type of calcium channel blocking property. Okay. Drug of choice, both are choice men. We got the gabapentin, pregabalin, both are choice. Right. Anti-epileptic useful in prophylaxis of chronic migraine. Can you please answer? Name some anti-epileptic useful for prophylaxis migraine. Here we are giving valproate, topiramate and gabapentin. Anti-epileptic useful for prophylaxis of migraines are valproate, topiramate and gabapentin. Valproate, topiramate, gabapentin. Don't say propranolol. My question, anti-epileptic. Anti-epileptic. Okay. Topiramate, valproate, gabapentin. Okay. Next. Name some anti-epileptic used as mood stabilizer that be useful in bipolar disorder. For example, carbamazepine, valproate and lamotrigine. Carbamazepine, valproate, lithium. I'm not asking lithium, man. Look at the question. Anti-epileptic useful in bipolar. Answer, carbamazepine, valproate and lamotrigine. I'm not asking about lithium. I'm asking about what are the anti-epileptic useful for bipolar. Valproate, lamotrigine and also carbamazepine. Okay, good. Next. Regarding antipsychotic chapter, we did neurology part. Now we go for psychiatry part. Look here. Regarding atypical antipsychotic, rapid fire round. Come on, answer. Name the atypical antipsychotic causes adverse effect of hypersalivation. It is clozapine. Clozapine. Okay. And remember, the hypersalivation is also known as pillow wet syndrome. Pillow wet syndrome. In this area, you should know some extra point. The clozapine also causing adverse effect of some important problem like myocarditis. It may cause myocarditis and also causing one very important thing called agranulocytosis. That too dose independent. Dose independent agranulocytosis. This is also important. Dose independent agranulocytosis. And another very important beauty point is this drug has anti-suicide activity. So atypical antipsychotic having anti-suicide activity, clozapine. This is the very, very, very important slide. You must know slide, must know slide. Okay. Next. Regarding atypical antipsychotic, just fill in the blank. Come on. Name the drug causing cataracts. It is quetiapine. Atypical antipsychotic causing cataract, quetiapine. Okay. Next. Name the atypical antipsychotic causing adverse effect of QT prolongation. Actually, repeating. So, ziprasidone and quetiapine. Ziprasidone and quetiapine. Ziprasidone and quetiapine. Both are causing QT prolongation. Yes. Now, name the atypical drug causes more EPS. Look here. Usually, atypical antipsychotic do not cause EPS or minimal risk EPS. But my question, name the atypical drug causes more EPS. Answer? It is risperidone. Very good. Because it has high amount of D2 blocking property. A atypical antipsychotic having highest D2 blocking property, risperidone. Good man, good. Next, name some atypical antipsychotic useful. Name the FDA approved drug for treatment of seizure affective disorder. Name the atypical antipsychotic approved by FDA for this case. Okay, it is paliperidone. Paliperidone actually a active metabolite of risperidone. Paliperidone a active metabolite of risperidone, useful, is FDA approved drug for treatment of this case. Okay, and then name the atypical antipsychotic useful for controlling agitation in this child. Case of autism, for autism child, to control aggression, either we can go for risperidone, aripiprazole, or ziprasidone. We can go for acinapine or aripiprazole, or we can go for risperidone. Okay, risperidone, aripiprazole, and ziprasidone. So question, to control autism, right? Yes. Next, name the atypical antipsychotic causing adverse effect of metabolic syndrome. This is important. Those drug name ending with pine. Quetiapine, olanzapine, and clozapine. Quetiapine, olanzapine, clozapine. The pine, they causes weight gain, diabetes. Name some atypical antipsychotic having less risk of causing metabolic problem. They're called ziprasidone, aripiprazole, acinapine. Some atypical drug do not cause weight gain, called ziprasidone, aripiprazole, acinapine. Remember one more question. The acinapine used sublingually. Name the sublingually given antipsychotic. Think of acinapine. Okay. Next. Very easy question. Name the antipsychotic causing blue-gray metallic skin discoloration. Name the antipsychotic causing blue-gray pigmentation on skin. It is chlorpromazine. Previously, what place, right? Ziprasidone, aripiprazole, acinapine. They causes less metabolic syndrome. Okay. Now, okay ma. Blue-gray metallic skin discoloration caused by chlorpromazine. Look at this question. Name some antipsychotic drug causing cataract. Just answer. Regarding cataract, I want name the typical antipsychotic causing cataract. Typical drug mean thiazidine. Whereas atypical drug causing cataract mean quetiapine. Typical mean thiazidine. Atypical mean quetiapine. And one more point, remember, among all antipsychotic, a drug causing maximum ocular side effect, thiazide. I go slow. Don't worry. Just make use of it. Among all antipsychotic, a drug causing maximum ocular toxicity, thiazide. Among all antipsychotic, a drug causing maximum eye problem, thiazide. Okay, next question. Repeating the point, somebody asking previous slide for them regarding antipsychotic drug and QT prolongation slide. Please note. Name the typical antipsychotic causing QT prolongation. Mean, think of thiazide and haloperidol. Typical antipsychotic causing QT prolongation. Mean, think of thiazide, haloperidol. Whereas atypical drug causing QT prolongation, we discussed already quetiapine and ziprasidone. Quetiapine, ziprasidone are atypical antipsychotic may cause QT prolongation. Anila, fantastic. Thiazide, haloperidol, typical drug causing QT prolongation. Good. Next, regarding EPS, come on. Regarding EPS, antipsychotic. The two typical antipsychotic causing maxi EPS what? Name the typical antipsychotic causes maximum risk of EPS. That is haloperidol. Haloperidol causes maximum risk of EPS. Okay. High metabolic syndrome. Somebody asking high metabolic syndrome. Pine, clozapine, olanzapine, quetiapine. They causes high amount of metabolic syndrome. Okay. Name the atypical drug causing maximum EPS, that is risperidone. Atypical antipsychotic causing maximum EPS, risperidone. And once again, name the typical antipsychotic causing least EPS. Name the typical drug causing least, mean answer thiazide, because it has highest anticholinergic. It has highest anticholinergic property. So least risk of EPS. So question, among the antipsychotic, typical having least EPS, thiazide. In this junction, I just go another 3 to 4 extra point. It may not be there in booklet. Just add. It useful, very useful. Regarding EPS, you should know 3 extra points. That 3 extra points are, look here. One type of EPS we call drug-induced Parkinson. It is extra point. Just note down. Very useful. Okay. Now, for treatment of drug-induced Parkinson, we can go for central anticholinergics. Note, the centrally acting anticholinergic like benzhexol or benztropine or biperidine or procyclidine. So, drug useful for treatment of drug-induced Parkinson, central anticholinergic like trihexyphenidyl, also called benzhexol. Other drug, benztropine, then biperidine and procyclidine. Here the most common drug is benzhexol. At least remember one drug name, benzhexol. Okay. Similarly, we have another type of EPS, very important, acute muscle dystonia. It is also one type of EPS called acute muscular dystonia. For this also same treatment. What treatment? Central anticholinergic. For example, either we can go for promethazine or benzhexol. Okay. Promethazine or benzhexol. Both are central anticholinergic. This is extra point, doctor. Extra point, please note. Benzhexol. For acute muscular dystonia, we go for promethazine or benzoxazole. Okay. Promethazine, first generation antihistamine, having very high anticholinergic. It has anticholinergic property. Okay. Next, very important, expect a question. Look at this. Tardive dyskinesia. Tardive dyskinesia. Look at the mouth. It's a bucco-linguo-masticatory movements. Bucco-linguo-masticatory movements. Now the most important question. Can you answer? Name the most preferred FDA approved drug for treatment of this case. Name the FDA approved drug for treating this case mean valbenazine. Remember valbenazine. Valbenazine, VMAT, vesicular monoamine transporter. Vesicular monoamine transporter 2 blocker. So VMAT blocker. Next, look at this. There's one type of EPS called akathisia, restlessness, urge to move. For this case, treatment is either we can go for clonazepam or propranolol. Both are choice, but very first choice, clonazepam. It's a benzodiazepine, very good choice. Also, we can go for propranolol. In this most important choice, first choice clonazepam. Second option, we can go for propranolol. Both are very useful for akathisia. Okay. With this, I'm moving to next one. Anti-Parkinson drug. Make it fast vision. Come on. Drug useful in treating Parkinson. Also approved for treatment of type 2 diabetes. Come on. Name the drug useful in Parkinsonism. Hereafter, just fill in the blank in your book. Come on, fill in blank. Name the drug useful in Parkinsonism. Also useful for diabetes. That is bromocriptine. Not bromocriptine. Bromocriptine. It's a D2 analog useful for diabetes. Good. Next. Answer please. Name some drug useful for treatment of restless leg syndrome. Name some drug useful for treatment of restless leg syndrome. The answers are pramipexole, ropinirole and rotigotine. They are the first line therapy. Pramipexole, ropinirole, rotigotine. But extra point, apart from this, we can also give one drug called gabapentin enacarbil. Gabapentin enacarbil. They also approved for treatment of restless leg syndrome. So the first three drugs are dopamine, D2 agonist, and it's a pro-drug of gabapentin. So pro-drug of gabapentin called gabapentin enacarbil. They are the drugs approved for treatment of restless leg syndrome. Next, ready? There are some drugs useful for all phenomena in Parkinson. In case of severe hypokinesia, to improve walking capacity, we use some drug. Just note, for treatment of all phenomena in Parkinson, the drug approved are COMT blocker like entacapone, opicapone. For treatment of all phenomena, COMT blocker like entacapone, opicapone. Marrow B blocker like selegiline. Marrow B blocker like selegiline. And then adenosine A2. A2 mean adenosine. Adenosine blocker estradiol. Either we can go for entacapone or opicapone, or we can use selegiline, or we can use estradiol. See, for restless leg syndrome, first line choice D2 agonist. Okay, and last one point. In case of severe off phenomena, we can also go for one more thing called apomorphine. It's a D4 agonist. Apomorphine, a D4 agonist, which also approved for treatment of off phenomena. It's a rescue therapy. Apomorphine, a D4 agonist given as an injection. It's a rescue therapy for severe off apomorphine injection. Okay, that finishes of femina on treatment. Okay, next, very important expected question, please answer. Name the FDA approved drug for treatment of Parkinson disease psychosis. Name the drug approved for treatment of Parkinson disease psychosis. Answers: pimavanserin. Pimavanserin. Please note, pimavanserin is the 5-HT2A inverse agonist. Pimavanserin 5-HT2A inverse agonist. It's FDA approved drug for treatment of Parkinson disease psychosis. Okay, good. All are answered nicely. Very good. Next, ankle edema and livedo reticularis are adverse effect of which anti-Parkinson drug? Answer: these are adverse effect of amantadine. Amantadine, a antiviral drug useful for influenza A virus. Amantadine, a antiviral drug useful for influenza A virus infection. It is also useful for Parkinson disease, causing adverse effect of ankle edema and livedo reticularis. Answer: amantadine. Next, answer please. Erythromelalgia is an adverse effect of what anti-Parkinson drug? Answer: ergot D2 agonist. Ergot D2 agonist like bromocriptine, pergolide and cabergoline. Ergot D2 agonist like bromocriptine, pergolide, cabergoline. They are the D2 agonists, causes vasoconstriction, causing erythromelalgia. Bromocriptine, pergolide, cabergoline. Okay, good. Answering nicely. Very good, very good. And they also causes, all these drugs also causing adverse effect of cardiac valve fibrosis. Cardiac valve fibrosis. Previously, what meant? Amantadine causes ankle edema, livedo reticularis. Okay, I do understand, doctor. I do understand, because I have to finish by 12, but I am extending up to 12:20. I am requesting my other faculty. So please understand, by 12:30, other faculty is short. Within that, I have to finish remaining thing. That's why I do understand. It's a revision course. It's not a regular class. So please try to understand thing. I want to give a lot of super point. Expect a question, rapid revision within 2.5 hours. You're going to master. Okay, so please wait. For treatment of Huntington chorea, what are drug of choice? Remember, the drug of choice for treatment of Huntington chorea includes we have tetrabenazine and deutetrabenazine. Tetrabenazine and deutetrabenazine are the drug of choice for treatment of Huntington chorea, and there are VMAT blocker, vesicular monoamine transporter, VMAT blocker, tetrabenazine and deutetrabenazine. Good. You are also typing very speedily. Fantastic, man. Follow me. And Tourette syndrome with the tics. Tourette syndrome with the tics. For this case, what can be done? Just fill blank. Either we can go for alpha-2 agonist like clonidine or guanfacine. For alpha-2 agonist like clonidine or guanfacine, for treatment of Tourette syndrome with the tics, we can try clonidine or guanfacine. If the response poor in non-responder, we can try aripiprazole. In non-responder, we can try aripiprazole. It is an atypical antipsychotic. Atypical antipsychotic, aripiprazole. Okay, so that's about movement disorder and treatment, right? Next, very important, latest MCQ, drugs useful for ALS. If there's the book, please note. For ALS, riluzole. Riluzole, one of the NMDA blocker, causing adverse effect of hepatotoxicity. Riluzole, NMDA blocker causing hepatotoxicity. Whereas Edaravone. Edaravone is an antioxidant. Edaravone, antioxidant. And latest point, we have one thing called antisense oligonucleotide drug named tofersen. Antisense oligonucleotide called tofersen. Tofersen. Okay. Next, antidepressant case. Look here. Very simple state question. Please answer. Name the group of antidepressant called drug of choice for all these three cases. For OCD, for post-traumatic stress disorder, and panic. For all these three cases, what is the best group of drug of choice? Answer. It is SSRI. SSRI. Previous slide, just add tofersen, doctor. Tofersen. Somebody asking, please slide. Anushka's too good. Previous slide, please note. We have riluzole, edaravone, tofersen. Okay. And coming to this one, the drug of choice for all these three cases, SSRI. Good, all right, good. Next, state question, one-liner. Name the antidepressant useful for treatment of fibromyalgia. Antidepressant for these cases, we go for duloxetine. Duloxetine, one of the SNRI, that is serotonin norepinephrine reuptake inhibitor. Good, Manushka, fantastic, super fast mark, very fantastic, good. Next, antidepressant useful for controlling smoking. Please answer. Name the antidepressant useful for controlling smoking. It is bupropion. Bupropion, one of the NDRI. That is norepinephrine dopamine reuptake blocker named by bupropion. Okay, good. Next, antidepressant and sex, very important expected area. Please note. Look at the question. We have one group of drug called SSRI. The SSRI causes adverse effect of delay in ejaculation. One of the sexual side effect of SSRI causing delay in ejaculation. But this adverse effect can be exploited for treatment of premature ejaculation. This is important. SSRI causing adverse effect of delay in ejaculation. But this property exploited for treatment of premature ejaculation. In this junction, can you please answer? Name the antidepressant having less sexual dysfunction. For example, we have one drug called mirtazapine. Please note, mirtazapine has least sexual dysfunction. Name any antidepressant causing less sexual dysfunction. Think of mirtazapine. Okay. And next question, very important. Look here. This was recently asked inicet question. Name the antidepressant causing adverse effect of priapism, painful penis erection, trazodone. Since it causing adverse effect of priapism, it can be useful for treatment of erectile dysfunction. So trazodone causes adverse effect of priapism. Because of this adverse effect, it can be exploited for treatment of erectile dysfunction. Okay, next. Look at this. Name the drugs useful for treatment of female with HSDD, hypoactive sexual desire disorder. In female, to improve the sex interest, we have some drug. For example, one is called flibanserin. Flibanserin, it's an orally given drug useful for treatment of HSDD. Flibanserin oral drug. Very good. Whereas I want to have something called injection. The injectable drug is bremelanotide. Come on. Bremelanotide. It's a melanocortin. Melanocortin stimulant called bremelanotide. It's an injection. So, oral drug mean flibanserin. Repeating, oral drug mean flibanserin, whereas injectable drug mean bremelanotide useful for treatment of HSDD. Next, two important MCQ, please answer. Look here. For treatment of postpartum depression, I have two approved drugs. One is intravenous. Anybody? Name the intravenous infusion you were given for 60 hours. Name drug. That is brexanolone. Please note, brexanolone. It's an intravenous drug for treatment of postpartum depression. Brexanolone. Whereas oral drug, zuranolone. This is expected question this year. Zuranolone, FDA approved drug, orally given drug, given for 14 days. Orally given drug for treatment of postpartum depression, zuranolone. Very important, expected. Okay, zuranolone. Next. Name the NMDA blocker useful for treating depression. That too given intranasal route. Fill in blank, S-ketamine. S-ketamine is a ketamine derivative. S-ketamine, it's a intranasal route useful for treating depression. Drug name S-ketamine. S-ketamine. Easy question, please answer. Name the alpha-2 agonist useful for treating depression. Alpha-2 agonist. Answer, dexmedetomidine. Dexmedetomidine. Alpha-2 agonist useful for treatment of depression. Dexmedetomidine. It's alpha-2 agonist useful for treatment of depression. Good. Next. Easy question. Box-shaped heart. It's called Epstein anomaly. My question. Name the drug causing teratogenicity of Epstein anomaly. It is lithium. Lithium, a drug useful for bipolar disorder prophylaxis. It is the teratogen causes problem of Epstein anomaly. Lithium. Very good. Next. Two questions regarding lithium and diuretic. Come on. Name the diuretic aggravate lithium toxicity. Name the diuretic aggravating lithium toxicity. It is thiazide. Thiazide will aggravate. Very good, ma. Anisha, very good. Very good. Whereas, no at this point. Name the diuretic useful for treating lithium toxicity. Name the diuretic useful for treating lithium toxicity. That is amiloride. Amiloride is the drug of choice for treatment of lithium-induced diabetes insipidus. So, amiloride useful for treatment. Okay, good, 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 good. Next, alcohol. Three questions, very important question. Come on. Name the most popular drug useful as a drug of choice for alcohol de-addiction. For de-addiction, drug of choice, disulfiram. Disulfiram. That is choice. Disulfiram. Okay. Next. After de-addiction, when you stop the drug, they go for withdrawal symptom. For treating withdrawal symptom, come on. For treating withdrawal symptom, we can go for benzodiazepine. Benzodiazepine. But one interesting question to all people. After proper de-addiction, please answer, to prevent the relapse. After de-addiction, to prevent the relapse, we can put them on dash. To prevent relapse, we can put them on naltrexone, or we can go for acamprosate. Naltrexone, one of the opioid antagonist. Acamprosate, NMDA blocker. NMDA blocker plus GABA agonistic property. GABA agonistic. So, after de-addiction, either we can go for naltrexone or acamprosate. Very good, man. Good, 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 good. Next. This was old question regarding alcohol withdrawal symptom. It's called delirium and tremor. For managing delirium and tremor, the choice will be benzodiazepine. But what are the important benzodiazepine useful for this case? Either we can go for diazepam or we go for most common drug. The most common benzodiazepine useful for managing delirium and tremor is chlordiazepoxide. Chlordiazepoxide. Whereas If the withdrawal symptom very severe mean, in severe cases, drug of choice will be lorazepam. In severe cases, we go for lorazepam. Anyway, benzodiazepines are the choice for managing alcohol withdrawal symptom. All are easy question. You also nicely answering. Fantastic. Good. Next, 3 question regarding methyl alcohol poisoning. Please answer. What is the antidote? What is the antidote for methanol poisoning? Just fill the blanks. It is 4-methylpyrazole, also called fomipizole. Fomipizole. It is the specific antidote. It inhibit alcohol dehydrogenase. So remember, the specific antidote fomipizole. Whereas adjuvant drug, we can use ethanol. Adjuvant is ethanol. One more point, doctor, please look at the chart. In methyl alcohol poisoning, formic acid causes problem of ocular damage. So, to control the ocular problem, I should make metabolism of formic acid. For that, I can supplement calcium leucovorin. Please note, calcium leucovorin. Good ma. Partha, fantastic. Leucovorin going to reduces the blood formic acid level by enhancing metabolism of formic acid. It is going to control the blood plasma formic acid level, thereby preventing ocular toxicity. Anyway, specific antidote fomipizole. Okay. Next, regarding morphine, 3 to 4 question, very important question. Please make it fast. In case of morphine addict, answer me. For de-addiction, drug of choice, methadone. Note, methadone is the drug of choice for de-addiction. If methadone option is not given, then we can go for buprenorphine. Remember, the drug of choice for opioid de-addiction, methadone. If not, next option, buprenorphine. Okay. Once again, for treating opioid withdrawal symptom, we can go for either beta blocker. Come on, note. For treating withdrawal symptom, we can go for either clonidine or lofexarine. The clonidine, lofexarine, both are alpha-2 agonists. But one simple question to all people, please answer. After proper de-addiction, to prevent relapse, what is the choice? After proper de-addiction, to prevent the relapse, we can put them on naltrexone. So question, after proper de-addiction, to prevent the relapse, we have to put them on naltrexone. Okay. So I am repeating, for de-addiction, choice is methadone. Whereas for preventing relapse, we can go for naltrexone. Okay. Next, for treatment of morphine poisoning, the first line drug of choice, intravenous naloxone. For treating poisoning, drug of choice naloxone. Whereas naloxone short acting, so maintenance therapy is naltrexone, oral naltrexone. First line drug of choice IV naloxone, followed by oral naltrexone. Okay. Next, opioid useful for treatment of pruritus in CKD. In chronic kidney disease patient, there is itching, pruritus. To control that, we have a new drug called nalfurafine. Please note, nalfurafine, a never opioid. Please note, new drug man, never opioid. So, nalfurafine, a never opioid, useful for treatment of pruritus in CKD patient. Chronic kidney disease to control pruritus. Okay. With this, last one question in CNS. Opioid causing maximum post-op truncal rigidity, body rigidity, called fentanyl group of drug. We are having alfentanil, alfentanil and sulfentanyl. They cause severe muscle rigidity. The muscle becomes so rigid like a wood. We call this wooden chest syndrome. We call wooden chest syndrome. Yes, good. Sulfentanyl, alfentanil, wooden chest syndrome. Fantastic, man. Answering good. Good. Next. 3 MCQ. Just note. For migraine cases, 3 new point. CGRP antagonist. Just write your name. Calcitonin gene related peptide blocker like OLCGban. Those drug name ending Gban. OLCGban, Telcagiban, Etogiban. The drug useful for treatment of migraine. We have something new drug, Gbans. We are having OLCGban, Telcagiban, Etogiban. And some MAB. There are some monoclonal antibody having CGRP antagonistic action. Please note. We are having erinumab, fremanizumab, galganizumab, and eftinizumab. We are having something called nuzumab, erinizumab, fremanizumab. Okay. And lastly, one more latest, 5-HT1F agonist. 5-HT1F agonist called lasmiditan. Lasmiditan, one of the latest drug useful for migraine, called 5-HT1F agonist. 5-HT1F agonist, drug name lasmiditan. Okay. And this is expected question. Name the drug useful in migraine prophylaxis causes adverse effect of retroorbital and retroperitoneal fibrosis. It is methotrexate. Just in the blank and note down methotrexate. Okay. Regarding anxiety, it's extra slide. Please note anxiety. Please answer. Name the 5-HT1A agonist useful for treatment of anxiety. It is buspirone. You have 5-HT1A agonist useful for managing anxiety. And then the most important drug of choice for performance anxiety is propranolol. The drug of choice for performance anxiety, propranolol. And this is important. Anxiety with panic disorder. SSRI. Anxiety with panic disorder, choice is SSRI. And antihistamine, H1 blocker. Name one antihistamine useful for treating anxiety. Mean, think of hydroxyzine. Hydroxyzine, a antihistamine useful for treatment of anxiety disorder. Hydroxyzine, an antihistamine useful for treatment of anxiety. Or else question can be, name the antihistamine having anti-anxiety property, hydroxyzine. Okay. Next, name the most popular drug useful for treatment of ADHD. It is methylphenidate and atomoxetine. The most popular drug useful for treatment of ADHD are methylphenidate and atomoxetine. Okay. Next, the latest MCQ, FDA approved drug for treatment of Rett syndrome. FDA approved drug for treatment of Rett syndrome. It is trofinetide. It's the latest inicet MCQ. Trofinetide. It's a drug useful for Rett syndrome. Very good, man. Very good. Next. Name the drug useful in this disorder, also useful off-label for AUD. AUD means alcohol use disorder. Alcohol use disorder. Now look here. This is a case of muscle spasm, scissoring gait. Here I need one skeletal muscle relaxation that is called baclofen. Baclofen. It is also useful for treatment of AUD. AUD. Okay. So question, baclofen, a GABA B agonist. A GABA B agonist useful for treatment of muscle spasm as well as useful for alcohol use disorder. Okay. And look at this. Regarding acromegaly, name the drug useful for acromegaly. The two somatostatin analog. Straight question, fill in the blank. Somatostatin analog name is octreotide. Octreotide. Somatostatin analog, octreotide. And dopamine analog. Dopamine analog useful for treatment of acromegaly, or we having bromocriptine and cabergoline. Dopamine analogs are bromocriptine and cabergoline. And once again, name the somatostatin analog useful for treatment of Cushing syndrome. In that fill, please note, Periotide. Periotide is a somatostatin analog useful for treatment of Cushing syndrome. Okay, but it is somatostatin analog. By last year question, one interesting question, name the growth hormone receptor blocker useful for treating acromegaly. It is pegosermin. Please note, pegosermin, growth hormone receptor blocker useful for treatment of acromegaly. Pegosermin. It is last year NEET PG question, you must know. Okay. Next, name the IGF analog useful for dwarfism. It is mecasermin. Mecasermin, IGF, insulin-like growth factor analog useful for treatment of dwarfism. Just note the fill blanks. Mecasermin, IGF analog. Okay. Name the hormone therapy useful to reduce abdomen fat due to HIV drug-induced lipodystrophy. In that, note tesamorelin. Tesamorelin, so growth hormone releasing factor analog. Growth hormone releasing factor analog called tesamorelin useful for treatment of HIV drug-induced lipodystrophy. Next, name the hormone therapy needs periodic fundus examination. Answer, growth hormone analog. Whenever you give growth hormone, they cause adverse effect of increasing intracranial pressure. So to rule out this, we have to do periodically fundus examination. So somatropin, somatropins are growth hormone analog, causes adverse effect ICT. So check the fundus. And treatment for hyperprolactemia, we go for D2 agonist. D2 agonist, for example, cabergoline and bromocriptine. Cabergoline and bromocriptine. Cabergoline, longer acting drug. Long acting. So it is the most preferred drug. The most preferred drug for treatment of gynecology, cabergoline, because of its longer in duration action. Next, I just add some extra point, definitely useful, please make. That is, what is the adverse effect of oxytocin? This picture may not be there, but note, adverse effect. Oxytocin causes adverse effect of rarely SADH. This was the old question. Oxytocin may cause adverse effect of SADH, and it may also cause vasodilation. But once again, important question. Anybody want to answer? Name the oxytocin antagonist. It is etosibon. Please hold. Oxytocin antagonist. Somebody asking previous ladies what? Bromocriptine, cabergoline, where cabergoline is the choice. Okay, but coming to this one, oxytocin antagonist etosibon. Please note this. And one more old question. PGF2 alpha agonist. Can I answer? Useful for treatment of postpartum hemorrhage. What drug? It is carboprost. It is also old question. Carboprost, it's a PGF2 alpha agonist, useful for treatment of postpartum hemorrhage. Next, anti-thyroid drug causing adverse effect of agranulocytosis. It is methimazole. Methimazole causes agranulocytosis. And anti-thyroid drug causing angioedema. Angioedema, just fill 1 point, iodine. Lugol's iodine causes angioedema. Lugol's iodine. Anti-thyroid causes hepatotoxicity. Propyl thiouracil, PTU. Anti-thyroid causing severe liver damage, PTU. Anti-thyroid drug causes aplastic cutis. In this picture, add thioamide. Thioamide, like methimazole, carbimazole. In this junction, can I answer? Name the safer drug in first semester. Name the safer anti-thyroid in first semester. It is PTU. PTU safe in first trimester. From second trimester, we can go for methimazole. For first trimester, we go for PTU. For second trimester, we go for methimazole. And just to fill in the blanks, and the drug inhibiting release of T3, T4 from follicle. Come on, imagine it's a follicle. Name the drug inhibiting release of T3, 4 mean lithium. Lithium. Name the drug inhibiting conversion of T4 to T3 mean think of amiodarone and propranolol. Inhibiting conversion of T4 to T3 are amiodarone, one more drug called propranolol. Again, very important, anti-TB drug. Anti-TB drug causing hypothyroidism. We have ethionamide and para-aminosalicylate. Ethionamide and POS inhibiting synthesis of T34 causing hypothyroidism. And finally, anti-hypertensive. Sodium nitroprusside. Sodium nitroprusside inhibits uptake of iodine. Inhibit uptake of iodine. By inhibiting uptake iodine, they cause hypothyroidism. So sodium nitroprusside anti-hypertensive causing hypothyroidism. Now, diabetes chapter, very important chapter. Please note, anti-diabetic drug reducing appetite. Reducing appetites are bromocriptine, pramlintide and GLP-1 analog. Anti-diabetic drug reducing appetite. We have bromocriptine, pramlintide and GLP-1 analog. Pramlintide, bromocriptine, GLP-1 analog. Okay. Next. Anti-diabetic drug insulin secretagogue. Note insulin secretagogue. We have sulf in the blank, right? Sulfonylureas, meglitinide, GLP-1 analog and DPP-4 inhibitor. The drug promoting secretions are sulfonylurea, meglitinide, GLP-1 analog and DPP-4 inhibitor. Easy question. Name some anti-diabetic drug causing insulin sensitization. They call metformin and pioglitazone. metformin and pioglitazone are called insulin sensitizer. Metformin and pioglitazone or insulin sensitizer. Okay. Anti-diabetic promoting excretion of glucose called SGLT2 blocker. Sodium glucose transport 2, SGLT2 blocker. Anti-diabetic drug approved for treatment of obesity. Very important question. Very important question. We have liraglutide, semaglutide, and latest is tirzepatide. Anti-diabetic approved for treatment of obesity are liraglutide, semaglutide, tirzepatide. Tirzepatide, a latest drug, a newer drug, useful for treatment of obesity. Liraglutide, semaglutide, tirzepatide. Anti-diabetic approved for both type 1 and type 2. Useful for both type 1 and type 2. It is insulin and pramlintide. Anti-diabetic approved for treatment of both type 1 and type 2. It is insulin and pramlintide. Anti-diabetic drug causing adverse effect of hirsutism and useful for treating these cases, metformin. Metformin approved for treatment of hirsutism and for PCOD. Just fill the blanks. Name the cholesterol lowering drug useful for treating diabetes. It is colisavalum. Colisavalum, a cholesterol lowering drug approved for treatment of diabetes. Colisavalum. Anti-Parkinson drug useful for treating diabetes. This we done already. It is bromocriptine. Anti-Parkinson drug useful for treating diabetes. Bromocriptine, a D2 agonist. D2 agonist. Anti-diabetic reducing CV risk. Reducing CV risk. Very important question. We are having liraglutide, semaglutide, liraglutide, semaglutide, canagliflozin, empagliflozin, and metformin. That is anti-diabetic reducing CV risk are liraglutide, semaglutide, canagliflozin, empagliflozin, and metformin. And one more important question. Anti-diabetic drug causing heart failure. Causing heart failure are pioglitazone and sitagliptin. Causing heart failure are pioglitazone and sitagliptin. Pioglitazone and sitagliptin. Just fill in the blank. Okay. And then anti-diabetic useful in treatment of heart failure. This is expected. There is one group called SGLT2 blocker approved for treatment of heart failure. For example, dapagliflozin, empagliflozin, sotagliflozin. Dapagliflozin, empagliflozin, sotagliflozin. SGLT2 blocker useful for treatment of heart failure. This was latest. Just fill in the blank. GLP and GIP analog useful for diabetes. Tirzepatide. Tirzepatide. Tirzepatide, a newer drug. It is useful for diabetes as well as useful for treatment of obesity. Tirzepatide. Very important question. Tirzepatide. Name the monoclonal antibody useful for type 1 diabetes. Monoclonal antibody. Drug name teplizumab. Teplizumab. A MAB useful for treatment of type 1 diabetes. Teplizumab. Teplizumab. Previous slide. Tirzepatide. Everything written in a booklet. You just note down this alone. Tirzepatide, a newer drug. Useful for treatment of diabetes. Okay. And teplizumab, A monoclonal antibody useful for treatment of type 1 diabetes. Okay. Next, anti-diabetic causing weight gain. Weight gain. We having, I am writing, you also write insulin. Insulin, sulfonylureas, meglitinides, and then pioglitazone. Anti-diabetic causing weight gain are insulin, sulfonylurea, meglitide, and pioglitazone. Heart failure, SGLT2 blockers. Okay. Whereas there is one question. Name some anti-diabetic causing weight loss. Weight loss. The weight loss we having, I am writing, please note, pramlintide. Pramlintide. Then GLP-1 analog. Then SGLT2 blocker. Then metformin. Metformin in some people weight loss, some people weight neutral, but maximally causing weight loss. Okay. Next, anti-diabetic drug causing adverse effect of medullary thyroid. Just write down only one point, GLP-1 analog. This and all written in a booklet. You just note GLP-1 analog causes medullary thyroid. And anti-diabetic drug causing adverse effect lung cancer. Inhalational insulin like Afratafreeh, it may cause lung cancer. Afratafreeh, a inhalable insulin. Anti-diabetic drug causing macular edema. It is pioglitazone. Pioglitazone causes macular edema. Macular edema. Anti-diabetic causing UTI. Very important question. SGLT2 blocker causes UTI. SGLT2 blocker causing UTI. And then anti-diabetic causes upper respiratory tract infection. We are having DPP4. DPP4 blocker. They cause upper respiratory tract infection. DPP4 blocker. DPP4 inhibitors. Okay. And then anti-diabetic drug causing adverse effect of Fournier gangrene. Fournier gangrene. It is SGLT2 blocker. SGLT2 blocker causing Fournier gangrene. SGLT2 blocker. Anti-diabetic causing osteoporosis. Table, everything given, let's fill. It is pioglitazone. Pioglitazone and SGLT2 blocker. Pioglitazone and SGLT2 blocker. And PCSK9 blocker. Just note down this alone in your notebook. PCSK9 blocker. Alirocumab. Evolocumab. Alirocumab. Alirocumab. Evolocumab. Both are cholesterol lowering antibody. Cholesterol lowering MABs. Drug useful for lowering cholesterol. Alirocumab, evolocumab. Very good, ma. Abhishek Roy, very good. And then CETP blocker. Just note down this. This is written in your notebook. You add it. Torcetrapib, anacetrapib. Torcetrapib, anacetrapib or CETP. Cholesterol ester transblocker. Torcetrapib, anacetrapib. MTP blocker. Lomitapide. Lomitapide. If we thoroughly written everything mean, you cannot not necessary to go anything. If we reason my topic and followed by Dr. Dinesh is going to come, if we thoroughly written all mean, no need to go any textbook, man. This is more than enough for your NEET PG. That's why you are struggling a lot. Okay. And then ACAT blocker, we are having avacimib. Avacimib. ACAT blocker, avacimib. Avacimib. It's a ACAT blocker. And then NPC1L1 blocker. NP-C1, Niemann-Pick C1 blocker. We having one drug called acetamib, not acetamib. Acetamib is a drug inhibiting absorption of cholesterol. It's a drug inhibiting absorption of cholesterol. Acetamib. And drug useful for ED. We have PDE5 blocker sildenafil. Here the important point, long acting. Name the longest acting PDE5 blocker useful for ED called tadalafil. We have sildenafil, vardenafil, tadalafil. Tadalafil is the longest acting PDE5 blocker. Just note this. The longest acting PDE5 blocker is tadalafil. Okay, and then intracavernous injection. Name some drug. Intracavernous injection mean think of alprostadil, PGE1, and then phentolamine, and then piperine. Intracavernous injections are alprostadil, phentolamine, and piperine. They are intracavernous injection. And then please answer. Name the antihypertensive causing adverse effect of ED. It is thiazide and beta blocker. Just in the fill in blank note. Thiazide and beta blocker may cause erectile dysfunction problem. Thiazide and beta blocker. Okay. Name the SCRM useful for inducing ovulation. It is state question. Clomiphene. Clomiphene is the drug useful for inducing ovulation. Ovulation inducing SCRM, clomiphene. Okay. SCRM useful for treating dyspareunia. This painful goitus. For this we use ospemifene. Ospemifene, a latest SCRM useful for treatment of dyspareunia. Ospemifene. Good. And latest point, please note. We have one drug called basidoxifene. Basidoxifene, SCRM useful for menopausal vasomotor symptom. Basidoxifene. Basidoxifene. It's the latest SCRM useful for treatment of menopausal symptom. And very latest expected this year, NK3 antagonist. NK3 antagonist useful for treatment of moderate to severe hot flush. Please note, fezolinetant. I'm waiting. It is expected this year. Please note. Fezolinetant. Fezolinetant. It's the latest NK3 blocker. NK3 blocker useful for treatment of hot flush. Fezolinetant. And just two drug name. Name the steroid useful for treatment, useful to improve lung maturity. One is betamethasone. One more drug, Dexa. This I want. Name the steroid useful for fetal lung maturity. One is betamethasone. One more drug, Dexa. Very good. Beta and Dexa. Very good, ma. Very good. Next. Name the soft steroid. Cyclizonide. It has no serious systemic adverse effect. We call soft in nature. That is no serious adverse effect. Called cyclizonide. This is last year question. Can I answer? Name the drug useful for treatment of steroid-induced oral thrush. I want some topical antifungal drug useful for treatment of steroid-induced oral thrush. We having nystatin or clotrimazole. We can go for either nystatin or clotrimazole. They are useful for treatment of topical, useful for treatment of oral thrush. Very good. Nystatin, or we can go for clotrimazole. Please answer. When they use steroid systemically, what is the ocular problem? Systemic steroid causes posterior subcapsular cataract. Systemic causes posterior subcapsular cataract, whereas topical causes glaucoma. Topical causes glaucoma. Systemic causing cataract, topical causing glaucoma. And regarding osteoporosis, please answer. Name the most wonderful drug inhibiting osteoclast. Add bisphosphonate. Remember. The most wonderful drug useful for preventing osteoporosis, bisphosphonate. Other drugs, denosumab, relaxin, but most importantly, bisphosphonate. Good. Next, name the most wonderful drug preventing osteoclast. The osteoblast, promoting osteoblast mean parathermone, like teriparatide, abaloparatide. Teriparatide and abaloparatide, the two wonderful drugs going to promote osteoblast activity, teriparatide and abaloparatide. And the drug have both action, promoting osteoblast and inhibiting osteoclast mean strontium. Strontium ranelate has both action, promoting osteoblast and inhibiting osteoclast, called strontium ranelate. It's a new point, anti-sclerotic antibody. We have something called romosozumab, blazozumab. Blazozumab. Both are antibody useful for osteoporosis. They have anti-sclerotic action. Very easy question. Name the drug useful in osteoporosis causes erosive esophagitis. It is oral bisphosphonate. Erosive esophagitis caused by oral bisphosphonate. Whereas kidney failure caused by IV bisphosphonate. Kidney failure by IV bisphosphonate. Name the drug useful for osteoporosis causing acute kidney failure, IV bisphosphonate. And name the drug useful in osteoporosis causes hot flush, relaxin. Relaxin causing hot flush. Name the drug useful in osteoporosis causes osteosarcoma. It is parathermone. Parathermone causes osteosarcoma. Osteonecrosis of femur neck. Steroid causes osteonecrosis of femur neck. Whereas easy question, name the drug causing osteonecrosis of jawbone. The mandible, it is by bisphosphonate. Bisphosphonate causes osteonecrosis jawbone, jaw. Okay. And name the drug useful for treatment of X-linked hypophosphatemia. Please note, it is burozumab. Just note, burozumab. It's a newer drug useful for treatment of X-linked hypophosphatemia. Okay. Next. Please answer. Name the drug causing meiosis and also increasing drainage of aqueous, useful for glaucoma. It is cholinergic. Please note, pilocarpine. Pilocarpine causes meiosis. Meiosis useful for glaucoma. So just fill in the blank, meiosis by pilocarpine. And next question. Name the drug causing mydriasis with the loss of light reflex. Atropine. Atropine causes mydriasis with the loss of light reflex. Just add atropine. And a drug useful for diagnosma called methacholine. We call methacholine challenge test. Methacholine challenge test. Diagnose asthma. Methacholine. Diagnose of myasthenia by hydrophonium. We call hydrophonium challenge test. Called tensilon test. A drug useful for diagnosing myasthenia, hydrophonium. Please I give 1 second time. Please answer. Name the drug useful for treating myasthenia. Go for paediatrics. It's a anticholinesterase. Anticholinesterase. Fantastic drug for treatment of myasthenia gravis. Paediatrics. And this expected question, may be useful for myasthenia gravis or rituximab, eculizumab, one more latest is rozanolixizumab, rituximab, eculizumab, rozanolixizumab, all are may be useful for treating myasthenia. Rozanolixizumab. 3 question, just fill in the blank. Name the topical drug useful for Alzheimer. Topical drug. Topical drug, it is rivastigmine, patch form, patch. Name the NMDA blocker useful for Alzheimer. It is memantine. NMDA blocker, memantine. And MABs, please note, expected question, aducanumab, one more drug, lecanemab. Aducanumab and lecanemab. I do understand, doctor. Some slide I am going fast only. I do understand. Especially sorry, extremely sorry, because I want to give lot of points. That's why. Just okay. You have video, it will come. Don't worry. So if I shortcut mean, it is useless. That's why. Okay. So may be useful for these cases. Aducanumab, one more drug, lecanemab. I can. If I prepare some question, if I leave some question, that's okay. But all are very important. That's why this one, okay. And just one point. Botulinum toxin is what? Note, it's an anticholinergic. It's an anticholinergic. It's an anticholinergic useful for mainly wrinkle correction. Wrinkles correction. And one more thing, since anticholinergic, very useful for overactive bladder. Overactive bladder. Okay. Then, answer please. Name the drug of choice for datura. Name the drug of choice for datura. Important question. It is physostigmine. Physostigmine is the drug of choice for datura. Regarding anti-smoking drug, name the most effective drug to control smoking. It is vernicillin. It's a repeated 2 to 3 times, doctor. Please note, vernicillin, an anti-smoking drug, most effective drug to control smoking. And name the patch form. It is nicotine. Nicotine is a patch form for smoking. Nicotine. Next. Very important, antidepressant useful for these cases. Bupropion. Bupropion antidepressant useful for controlling smoking. And anti-epileptic useful to control smoking are topiramate. Anti-epileptic topiramate. And alpha-2 agonist used as SMR is tizanidine. Tizanidine, a alpha-2 agonist used as a skeletal muscle relaxant. Alpha-2 agonist used as a pre-anesthetic medication, dexmedetomidine. Alpha-2 agonist used as a pre-anesthetic medication, dexmedetomidine. Alpha-2 agonist useful for treatment of opioid without symptom. We discussed clonidine and lofexarine. Clonidine, lofexarine, alpha-2 agonist useful as for managing without symptom. Adrenergic drug useful for cardiac stasis, dobutamine. Dobutamine is a beta-1 agonist useful for stress testing, dobutamine. Next, fill in blanks. Cardiac shock with oliguria. Drug of choice, dopamine. Dopamine is the choice. Acting on D1, beta-1, alpha-1 is the choice. Name the drug useful for overactive bladder. That do adrenergic. Beta-3 agonists like mirabegeron, Vibegeron. Mirabegeron, Vibegeron are beta-3 agonists useful for treatment of overactive bladder. In this, I take another 1 second time. You must know, doctor, even though time consumes, you must know drug acting on bladder, very important. And one more question, Name the drug of choice for treatment of anaphylactic shock. It is intramuscular adrenaline. The choice is intramuscular adrenaline. And then for hypertensive emergency, name the beta blocker, mean labetalol. It is the drug of choice. The choice. And then this is a new point. Beta blocker useful for treatment of infantile spasm. Propranolol. Please note, propranolol useful for treatment of infantile hemangioma. Propranolol. And then one latest point, beta blocker useful for Smith imagining. Acebutolol. Just note, acebutolol useful for Smith-Magenis syndrome. Acebutolol. And beta blocker very useful for heart failure. Carvedilol. It's a beta plus alpha blocker very useful for heart failure. Carvedilol. And beta blocker causing QT prolongation. Sotalol. It's a class 3 drug causing QT prolongation. QT prolongation. Please answer. I give 1 second time. Please answer. Name the beta blocker useful for all these 3 cases. That is HOCM, akathisia, performance anxiety. What is choice? Answer, propranolol. Propranolol is a choice. Very good. And this is what I told. Drugs acting on bladder, you must know. Take 1 second time. We are having M3 antagonist, anticholinergic, oxybutynin. Beta 3 agonist, mirabegron, causes detrusor relaxation, thereby causing urine retention. This property useful for treatment of overactive bladder. Whereas M3 agonist, bethanacol, causing contraction of the detrusor, useful for treatment of post of urine retention. Whereas we have one thing called duloxetine. Duloxetine, one of the SNRI, useful for stress incontinence. Duloxetine. And then tamsulosin, a alpha 1 blocker, useful for treating BPH. Tamsulosin, useful for BPH. And then, please answer, name the most common adverse effect of salbutamol. It is tremor. And the adverse effect of theophylline due to adenosine blocking. Come on. It is convulsion. One more thing, diuresis. The 2 important adverse effects of theophylline because of blocking adenosine are seizure and diuresis. Name the anticholinergic causing paradoxically bronchospasm. Ipratropium. This is INC question. Ipratropium having benzalkonium chloride. We had some adjuvant. We are adding some ingredient called benzalkonium. It may cause bronchospasm. And then Choctaw syndrome adverse effect of Montelukast. In this, note 1 point. For treating this case, we can try mepolizumab. Okay. So for treating this case, we can go for mepolizumab. And this for difficulty, cyclizumide, soft tissue steroid. And then leukotriene antagonist causing hepatotoxicity. Come on, answer. It is Xelotam. Xelotam causing hepatotoxicity. And latest point, new point. Thromboxane A2 antagonist useful for treatment of bronchial asthma. We have a new drug called Ceredrodast. It's a newer drug useful for asthma. Ceredrodast. Name the MAB. I given table, fill blanks. IgE blocker omalizumab. Whereas IL-4 blocker dupilumab. And then IL-5 blocker mepolizumab, racilizumab and benralizumab. And then IL-13 blocker tralokinumab and lebrikizumab. IL-13 blocker tralokinumab and lebrikizumab. Okay. Omeprazole, clopidogrel drug interaction based on CYP2C19 discussed already. Just fill CYP2C19. Name the group of drug useful for gastritis causing B12 deficiency. It is proton pump blocker. Proton pump blocker. Answer: Mobius syndrome adverse effect of misoprostol. Misoprostol. It's a prostaglandin analog teratogen causing Mobius syndrome. Gastric bizarre adverse effect of sucralfate. Sucralfate causes adverse effect of constipation and gastric bizarre. Gastric bizarre. Drug causing black color tongue. Bismuth. Bismuth causing black color tongue. And for chemotherapy vomiting, first line choice 5-HT3 blocker. Remember, 5-HT3 blocker are the first line choice, like ondansetron, pelnosertron. Ondansetron, pelnosertron. But this was a very old question. But what we expecting new question? Name the group of drug useful for late phase vomiting. Please note, for treatment of late phase vomiting, NK1 antagonist like aprepitant, fosaprepitant, P10, fosaprepitant, they are the choice for late phase vomiting. And antiemetic for motion sickness. Come on, fast. Name the antiemetic for motion sickness. It is scopolamine. Scopolamine, also called hyoscine, or else we can try promethazine. Best is go for scopolamine, anticholinergic. And then, for seasickness, we go for meclizine. Please note, meclizine, a antihistamine. Antihistamine useful for seasickness. And for mountain sickness, answer is ask them to come down rapidly, rapid descent, or else go for acetazolamide. For mountain sickness, go for acetazolamide. And for body sickness, best is go for doxylamine. Doxylamine is an antihistamine with the B6. Antihistamine with the B6. Okay. And then antiemetic causing adverse effect headache called ondansetron. And then antiemetic causing adverse effect EPS. Come on. Name the antiemetic causing EPS. That is metoclopramide. Metoclopramide is a D2 blocker. Okay. And antiemetic causing red eye. That is nebilone and dronabinol. Both are cannabinoid causing red eye. Nebilone and dronabinol. The drug causing pigmentation of colon, melanosis coli, pigmentation called senna. Senna causes pigmentation of colon. Ischemic colitis, adverse effect of allosertron. Allosertron, a 5-HT3 blocker, causes ischemic colitis. Name the drug activating guanyl cyclase. Fill blanks. We are having linaclotide and pliconatide. It's a they are CFTR activator, also called guanyl cyclase activator, linaclotide and pliconatide. Whereas CFTR blocker useful for treatment of diarrhea, crofelemer. Please note, crofelemer is the CFTR inhibitor. CFTR inhibitor useful for treatment of HIV drug-induced diarrhea. Crofelemer, CFTR inhibitor. Okay. Direct chloride channel activator useful for treatment of constipation diarrhea. Direct chloride blocker activator lubiprostone. Lubiprostone is the direct chloride channel activator useful for promoting motility, useful for treatment of constipation. Answer please. Name the antimicrobial agent promoting motility. Macrolides. Erythromycin, a prokinetic agent. Acting on motilin receptor going to promote motility, useful for gastroparesis. And this is expected question. Name the GLP-2 analog useful for treatment of short bowel syndrome. Teduglutide. Please note, teduglutide. Teduglutide is a GLP-2 analog useful for treatment of short bowel syndrome. Alpha 4 beta 7 integrin antagonist name is vedolizumab. Please note, vedolizumab, alpha 4 beta 7 integrin antagonist useful for treatment of constipation. And gallstone dissolving drug ursodeoxycholic acid. Ursodeoxycholic acid is the gallstone dissolving agent. And opioid induced constipation. Just one new point, doctor, for treating this note. Peripheral opioid blocker. Peripheral, in GAT, there are some opioid drug antagonistic action called albumopin, methyl naltrexone. They are all useful for treatment of opioid induced constipation. Methyl naltrexone, albumopin, naloxegol useful for treatment of opioid induced constipation. And then drug of choice it's not there in the book. Please note, drug of choice for treatment of carcinoidria, octreotide. Drug of choice is octreotide. Adjuvant supportive drug is telotristat is a supportive drug. Okay. And then finishing question, just 2 minutes I'm going to finish. Name the anti-TB drug causing adverse effect of uveitis, that is rifabutin. Anti-TB drug causing uveitis, rifabutin. Alpha 2 agonist causing uveitis, brimonidine. Brimonidine useful for treatment of glaucoma but causes adverse effect of uveitis. Next, tyrosine kinase inhibitor causing dysmorphic eyelash. Look at this, abnormal texture, abnormal color. It is caused by erlotinib. Erlotinib causes dysmorphic eyelash. And the cardiac drug causing orthus keratopathy. I think easy question. Amiodarone. Orthus keratopathy, amiodarone. And ACRM causing crystalline maculopathy. It is tamoxifen. Tamoxifen, ACRM causing adverse effect of crystalline maculopathy. Bullseye maculopathy, easy question, chloroquine. Bullseye maculopathy, chloroquine. And posterior subcapsular cataract, systemic steroid. Systemic steroid causes posterior cataract. And visual field of vision defect, we discussed already, vigabatrin. Okay. And then angle closure glaucoma, topiramate, discussed. Now I give chance for you. Please answer fast. Come on, answer. Name the anti-ability causing retinal damage. That is isogabine. Isogabine, also called retigabine. It's a potassium opener, causes adverse effect of retinal damage. This is expected question. Name the drug useful for treatment of vitreomacular adhesion. That is acryplasmin. Acryplasmin useful for treatment of vitreomacular adhesion. And name the metal poisoning causing K-ring. It is copper poisoning. In copper poisoning, K-ring. And please note, for treating this case, best is zinc. Zinc is the best drug. For treatment of copper poisoning, zinc is the best. And in this picture, answer B. Because look at, timolol is acting by reducing aqueous production. Okay. And right picture is timolol reducing aqueous production, not the promoting drainage. Now, just 1 minute, doctor, please answer. Name the anti-glaucoma drug causing adverse effect of lid lac. It is apraclondine. Lid lac is apraclondine. Anti-inflammatory drug causing uveitis. Discussed already. Brimonidine. A alpha-2 agonist causing adverse effect of uveitis. Anti-inflammatory drug causing bronchospasm. Nasolacrimal duct obstruction. It is beta blocker. Beta blocker causes bronchospasm. Even nasolacrimal duct obstruction. Answer please. Name the drug useful in glaucoma causing cataracts. It is ecothyphoid. Ecothyphoid causing cataracts. And then name the drug useful in glaucoma causes iris pigmentation, cystoid macular edema, and hypertrichosis of eyelash. It is prostaglandin analog. Latanoprost, bimetoprost, prostaglandin analog useful for this case. I mean they cause adverse effect. And red eye by dipephyrin. Dipephyrin, a prodrug of adrenaline. Prodrug of adrenaline. It causes red eye problem. Red eye. And then for treatment of ARMD, intravenous VEGFR blocker, verteporfin. Verteporfin. It's a intravenously given VEGFR. But after the question, intravitreous injection. Bevacizumab, ranibizumab, begaptanib, and aflibercept. Please at least note on first two drugs. Bevacizumab, ranibizumab are VEGFR blocker given intravitreally. And please note, antidote for benzodiazepine, flumazenil. Antidote for benzo is flumazenil. Antidote for treatment of morphine, naloxone. And antidote for TCA poisoning, sodium bicarbonate. And antidote for methanol, fomepizole. For methanol, fomepizole. Okay. And for treatment of atropine poisoning, drug of choice, physostigmine. For atropine, physostigmine. Can anybody name the antidote for digoxin? It is digibind. And antidote for paracetamol, N-acetylcysteine. N-acetylcysteine is an antidote for paracetamol. And then drug useful in MS, multiple sclerosis, causing cardiotoxicity, and secondary cancers, mitoxantrone. Mitoxantrone, an antibiotic anti-cancer drug, causes cardiotoxicity and secondary cancer. Drug useful MS causing adverse effect of bradycardia and macular edema. It is fingolimod. Fingolimod causes bradycardia and macular edema. Fingolimod. MS drug causing progressive multifocal leukoencephaly. We call PML. It is by natalizumab. Natalizumab, a alpha-4 beta-1 antagonist. It causes adverse effect of PML, progressive multifocal leukoencephalopathy. And then drug useful MS causing adverse effect of liver damage, teriflunomide. It's a leflunomide derivative causes hepatotoxicity. Teriflunomide causes problem of liver damage. Teriflunomide. And drug useful MS causing neutropenia is cladribine. Cladribine, an anti-cancer drug. Anti-cancer drug causing myelosuppression. And drug useful for treating obesity. Name the anti-abrotimine. Think of zonisamide, topiramide. They cause weight loss, thereby cause useful for obesity. Zonisamide, topiramide. We discussed already in epilepsy topic. Antidepressant useful for treating obesity. Bupropion, NDRI. Anti-diabetic useful for treating obesity. Liraglutide and semaglutide. GLP-1 analog. Liraglutide and semaglutide. One more new drug, tirzepatide. You may think, doctor, I'm too fast. I do agree. I have done all the CNS, all the endo, all the ANS, all the so-called CVS, renal, blood, everything, doctor. What we're discussing 4 days within 2 hours and 40 minutes. Imagine this energy and the preparation, how to accumulate everything together. So, tirzepatide. And then melanocortin analog useful for treating obesity. Setmelanotide, a melanocortin agonist useful for treating obesity. Lipase blocker is orlistat. Orlistat is the lipase inhibitor. And finally, a sympathetic stimulant useful for obesity, phentermine, a sympathetic stimulant. And last but not least, opioid antagonist useful for treating obesity, naltrexone. Okay. Imagine, doctor, if you are sincerely follow my discussion, or after some time you go and revise the video, definitely you become master in pharmacology. Okay. See, before DVT, all pharmacology questions like this, they may threaten you. During DVT, you may be tired because of too much of topic, too much of information. But I'm damn sure after DVT, pharmacology became very, very simple. You can throw it off easily. Okay, you can enjoy pharmacology. All Damsonian, definitely you're going to become Amsonian and very good NEET PG aspect. Okay, so all the very best. I take a lot of time, but it's still worth, I think. If you revise the video, you can become master, no doubt in this, with your support. Thank you very much. All very best, doctor. Thank you.